Minister of Health giving his remarks, and of course our Prime Minister as well giving his remarks at this event.
Okay.
And we will be announcing soon our keynote speaker who's going to take us home with a charge as to how to break the barriers that exist of this slavery of the brought about by NCDs.
Can we really break the barriers though? Do you believe it can happen?
Definitely. In our
in training leaders, we will be developing almost something similar to a memorandum of understanding or conditions to train leaders that persons must implement the program after the training. The training for leaders, it can be done in two ways. We can have face-to-face training for leaders, which is a 5 full-day workshop. And at the end, part of the training is that there are 2 teaching practices that the person must successfully complete. Each leader must successfully complete and then the leader, after the training, you must implement 1 community workshop within 12 months of the training. There are persons who were trained and we had great difficulty in getting them to implement 1 workshop within a year's time. So we want to train persons who are really interested in implementing the program. The other mode of training is that there can be a virtual leaders training, and this virtual training, it's 13 sessions online, and it is 1 session per week. With the virtual training, persons are trained both as participant in the program and also as a leader. And there is the teaching practice also. So we do have plan to train more leaders, but we will be going about doing it differently and also with the help of POW. Because as a master trainer, I need another master trainer to do the training. And although right now I'm the only one on the Ministry of Health, but there are other regional trainers that I've worked with that we can offer the program. So you can imagine it's not at a cost to participants, but it will be, usually we get support from POW, so it's at a cost to POW, whether it is face-to-face, whether other master trainer has to come in on island, or whether we do it virtually. But persons who are interested in being leaders, you can contact me. You can contact Dr. Lucia at the ministry. And when we do have that program, we're offering the program for leaders, you will be contacted. But I do encourage persons, if you're interested in being a leader, it's very important if you get the opportunity to participate in the program as a participant, so you get a better idea what is the program all about, and then you can decide if you really want to be a leader for this program, facilitating this program. I hope I've answered your question. Someone said that the program, well, as a participant, the program is open to anyone living with a chronic condition. The program is also open to caregivers of that person, their family member. You can register at your nearest wellness center. You can also call Bureau of Health at the ministry, and you can register, inform your nurse or any other healthcare worker at the wellness center that you're interested. Once any community or wellness center has the number of participants that I mentioned, that we can come in and offer the program. So if you want a virtual program, it's 8 to 12 persons. If we're going to do it face-to-face, then it is 12 to 16. So once we have this number of persons, we come into the community and we offer them. Yes, the presentation can be shared. Not a problem. Yes, the program is open to everyone. It's open to nurses, doctors, anyone who wants to participate in the program. It is open. However, the program is really a pair-led program. They encourage that at least one of the leaders should be somebody living with a chronic condition, but it's not a must because I'm a nurse. At that time, I had no chronic condition from 2015, and I was a leader, a master trainer in the program. But professionals can participate in the program and be leaders in the program also. Once you are willing to devote the time and implement the program as it should, you are welcome to participate in the program. I must mention also that I'm aware that the program was being offered by the St. Lucia Lupus and Arthritis Association at some point, even before the minutes had the program. So it's a well-implemented program. Yes, I'm here, Doc.
Hello and welcome to today's discussion by way of a conversation on the International Day for the Remembrance of the Slave Trade and its Abolition. This is a day observed by the United Nations every year on the 23rd of August, and we thank you for joining us today and being part of making history insofar as taking the issues to St. Lucia throughout Emancipation Month, the second Emancipation Month designated since 2021. And today's discussion is coming to you courtesy and on and through NTN and UETV Global, online and on your screen. And of course, we hope you stay with us over the next 90 minutes. We have in-house guests, we have guests online who we will introduce in a while, but to put today's discussion, conversation in context, we want to point out and share with you what the United Nations through UNESCO would like us to know about today, because every 23rd of August is the International Day for Remembrance of the Slave Trade and its Abolition, but it also comes against the background of two other international days that the UN recognizes for in relation to slavery. And one is, the first every year, is the International Day for Remembrance of Victims of Slavery and the Transatlantic Slave Trade, and that is on March 25th every year, memory of the victims. And then today, August 23rd, it's the International Day for Remembrance of the Slave Trade itself. So March, remembrance of the victims; August, remembrance of the trade. And on December 2nd is the third activity sponsored by the UN in relation to slavery. And that is the International Day for Abolition of Slavery, and that is to recall the United Nations General Assembly's adoption of the Convention for the Suppression of the Traffic in Persons and Exploitation of Others, and that resolution was number 317, passed on the 2nd of December 1949, 4 years after the United Nations was formed. So recognition of the importance of recalling but also condemning transatlantic slavery is so important that the United Nations recognizes it 3 times over the years and is calling on all member entities, all member organizations, all nations to join each of those celebrations. So to put today's into perspective, let me share with you what the United Nations is sharing online today. And that is that the choice of 23rd August is because on the night of the 22nd to the 23rd August 1791, in Saint-Domingue, today the Republic of Haiti, saw the beginning of the uprising that would play a crucial role in the abolition of the transatlantic slave trade. It's against this background that the International Day for the Remembrance of the Slave Trade and its abolition is commemorated on the 23rd of August every year. It was first celebrated in a number of countries, in particular in Haiti, on 23rd August 1998, and Gorée Island in Senegal, 23rd August 1999, the following year. And this International Day is intended to inscribe the tragedy of the slave trade in the memory of all peoples. And in accordance with the goals of the intercultural project called The Roots of Enslaved Peoples, it should offer an opportunity.
The skills are repetitive, so 4 sessions, you should give enough exposure and practice to a participant to gain mastery and competence in the skills that are taught in the program. And also for persons who are interested in becoming leaders, it's very important to that you can speak the Creole, because there are things that you really need to break down to participants' level so that they can understand what it is that is expected and understand what's being taught in the program. Well, it depends on the community you're in, you know. So persons who are more comfortable with the Creole, you may need to translate some of the things and break it down using the Creole language.
Pour l'instant, je dis ici, Castries, en Martinique, en Guadeloupe, avec un autre pays, en Haïti, tout partout, côté langage créole qu'a parlé, ou ça, ouest. And therefore, therefore, we will take a further look at what's happening today, and this is also again Africans during the transatlantic slave trade was driven by the racist ideology that these women, men, and children were inferior because of the color of their skin.
Pleasure, actually. The chronic disease, the capacity building project for the prevention and control of metabolic chronic diseases. This project arose from an agreement between the St. Lucian government with the Ministry of Health and the Taiwanese government, Taiwan ICDF, to undertake the project because of some of the results of studies that had been done with the STEP survey and the behavioral risk survey that had been done. And so those studies had revealed that we had a significant number of our population that was obese. I'm talking about 65 to 70%. And the percentage of patients that were finding out that they were diabetic and hypertensive.
With Laura. Laura Trevelyan is known to most of us, or all of us, who have viewed BBC TV World Reports. She's been a presenter at BBC TV out of New York for decades, and she volunteered to accept our request, our invitation this year when the Trevelyan Fund was launched in Grenada, and that came on the back of a meeting we held here in St. Lucia with Lucy Gaffney, who is going to be following Laura, representing the repair campaign. And these ladies will both be making their presence.
Intends on having 15 healthcare providers, doctors, nurses, nutritionists, and the CDSMP leaders to be trained in Taiwan to return and train the other team members for us to improve our health screening capacity and our counseling capacity, because we would like for us to see not only better control hypertensive diabetes and patients with kidney disease, but less patients having the complications of high blood pressure and diabetes, ending up with chronic kidney disease. And we would also like to know what our at-risk population is. When we know what the at-risk population is, then we can better change lifestyles to reduce the incidence of high blood pressure and diabetes. And we can start having a different conversation as to preventing or delaying the onset of the chronic diseases that we're trying to liberate ourselves from. So I was very happy to find out from Dr. Daw that this annual event will be happening, the Liberation and Emancipation, Freedom from Chronic Diseases, because it works out very well with what the Ministry of Health is now undertaking through the capacity building project. And there are a few other initiatives, if you would permit me, that I would mention, like knowing your numbers, which I knew about when I was preparing my presentation for the medical nutrition therapy, which is why I had mentioned we need to ensure that our patients know your numbers. Also, we have the St. Lucia Moves initiative, which is a local branch of something that is actually international. And so there is Caribbean Moves, we have St. Lucia Moves, there is Grenada Shifts, there's Jamaica Moves, and the ministry has been tasked to be responsible to ensure that we have workplaces and schools and faith-based organizations and NGOs like SLHDA, ensuring that there is a workplace wellness program, that we encourage physical activity, that we highlight the benefits of physical activity and how you can actually involve physical activity in your daily life by having every 30 minutes or every hour you do 2 to 3 minutes of walking or stretches. So the ministry has been working on many different initiatives, all of them which tie together. And so you find the same people working on the different initiatives, but although they all have different names, the goal is the same. The goal is to ensure that we have a more physically active society. We have a society that eats healthier. We have a society that's more aware of their chronic condition, if there's one, aware of their vitals, aware of the importance of their annual screening and annual checks, aware of the importance of their dental hygiene. So it is an educational drive, basically, and to pull in all of the key stakeholders, because it cannot be the Ministry of Health on its own. The stakeholders would pull their weight, as I would say, in terms of getting all of society involved. And so the capacity building project is working with the ministry to ensure that those goals are achieved. Any questions?
In April has been contacted by scores of descendants of enslavers from across the British Caribbean. Compensation, in effect, was used to colonise Australia and New Zealand, which again is something that's little taught in Britain. And essentially there are two strands to the...
Okay, there is one correct answer to that, because what pertains to you and your busy lifestyle does not pertain to me and my busy lifestyle. But there are some foundational rules that would apply. Basic lifestyle change is key. We need to understand that the multidisciplinary approach and patient-centered care is essential. We need, as healthcare providers who are patients ourselves, we need to ensure that we spread the word, we educate our population that lifestyle has a much more important role than they may realize. What I usually explain to my patients is your healthcare and your achieving healthcare goals is like riding a horse. Your horse has 4 legs. In that, you have one leg, which would be your lifestyle. Your other leg would be your diet and exercise. I give a whole leg to water for hydration and kidney health and all of that stuff. The last leg is made up of your healthcare team, your healthcare providers. So you have your dentist, your nutritionist, your mental health nurse, your pharmacist. You have all of those, plus the medication on one leg. If you cut off one leg, you will limp, you will hop as a horse. You may not be able to gallop and go far. But if you cut off the 3 legs, you cut off lifestyle, you cut off water consumption, you cut off stress management, you cut off those things, you cannot get anywhere. So we need to understand as individuals, stress management. We need to understand socializing. We need to understand our sleep habits. We need to understand that those things that are heavily dependent on us, these things play an essential role in how well we do as individuals with our chronic conditions, and so how well we do as a society and a country. And then comes the role of our policymakers to highlight and emphasize the importance of lifestyle changes and being aware of the need for somebody to be able to
in Jamaica, that there is a tide in the affairs of men, and on such a full sea are we now.
Okay.
Yeah. Good evening, Dr. Doe. Let me say that this is a most welcome activity, but I think it is important for this not to be just a one-off thing. And speaking from my location in Beaufort, I think it would be a good thing to have this sort of thing repeated more than once. It is something that has to be ongoing. And I don't know if you can get a commitment from the ministry to further assist us in getting this important message across to the whole of St. Lucia, particularly the southern heart of the country.
Well, I would like to thank the association for having me as a presenter this evening. I just want to encourage you, Dr. Daw, the president, and the association in revamping the community groups, because it is very important if we have functioning community groups as we did in the past, that we can work through them, especially when it comes to education and even creating an increased awareness of chronic conditions and how persons can prevent, early screening and management. So I'm looking forward to see the groups being revamped and being as active as they used to as part of the association. Thank you.
Mic check, 1, 2. Mic check. Testing for sound. Mic check. Welcome to Breaking Barriers, the Emancipation Gala, 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 Gala. TV. Easy. We won't head. That's right. Thank you very much. Good evening, Dr. Do.
Good evening, Mr. Justin. Sant Justin?
That is it, yes.
Please help me out there.
Very hard. You're very hard, sir.
I will do my best. So thanks for having me. Well, I am the host, as you said.
That's right. So you take the mic.
Thanks for having me. So, yes. He's almost taller than me. Just a little bit. Right. So tonight, welcome everyone. Welcome one. Welcome all. Our theme: breaking barriers. We are here at the Green Acres Cabana, live filming this virtual first annual event, Emancipation Gala for the St. Lucia Diabetes and Hypertension Association. We thank you so much for joining us. We thank you so much for making this happen. All right. Without you, it would not be possible. All right. And this gala started off as a need to stand out. The association, the board met, and we said, we really need to find a way to make ourselves more visible. We need the St. Lucian public to understand that we are here for you, we are here with you. And what better way than to come out boldly and have a flagship annual event? Now, like everything else, money talks, right? Yes. So, of course. Yes. So, of course, it is also a fundraising event. What does that mean for fundraising? Yes. So we have to get the checkbooks ready.
That's right. That's right.
Check the balance on the accounts. Get the cards ready. Yeah. All right, because we have quite a few things lined up for us, right?
We do.
Yes. We have what is it we have again?
Right. So to talk a little, let me introduce the upcoming silent auction. We have a few giveaways to do later, but unfortunately, only persons on the Zoom can participate, and you participate by sending in your bid. Put it in the comments. We'll go in there a little later. Private message to the president of the SLDHA, who is standing right next to me. That's Dr. Do.
Yes.
Right. So just to let you know what we have auctioning a little later, we have a dinner pass.
Oh, nice. Dinner pass. Yes. A lovely dinner pass at one of our lovely resorts, the Cocoa Palm Resort. Yes.
Actually,
we also have another one at the Sandals House here.
Well, I believe Cocoa Palm has given us the brunch. Yeah. So there's a brunch pass and the dinner pass.
So can I win both? How about if I it's a bid. So if I bid for both, I can do brunch at one resort and dinner at another. Isn't that awesome?
I'll have to check the rule book to see if you can bid. Yeah. But yes, you can bid on both dinner pass.
Don't mind the big belly, but I could do some brunch and dinner. Thanks.
A good thing you should have pointed that and not me. Apart from the dinner pass and the brunch pass, we have a bathroom chair. What exactly is a bathroom chair?
Oh, our friends at Peter and Company Distributors gave us this lovely device. So if we haven't noticed, our population is aging. It means medicine, technology is putting us in a position where we can live longer. As a result, those joints will start to hurt. Some of us, it starts early. Yes, those joints are starting to hurt, and you might just need some help to even take a shower. So there's this lovely chair that you could sit on in the shower and take care of that important part of your day. All right.
Do you need to have joint pains to use that shower though?
Well, I'd hope that we want to stay clean.
Asking for myself, by the way.
Yeah, you don't need to have joint pains, but it was designed for that. I will not even read into what it is you're thinking.
What I was actually thinking was, anyway, we also have 2 cell phones to give away.
Yes. Our sponsors, again, we could not do it without you. So everyone out there, look forward to getting lots of giveaways and taking part in this auction. So it's a cell phone provided by the Cell and one provided by Digicel. No, the Cell has the tablet.
Right. There's a tablet and a cell phone.
Tablet, cell phone, and another cell phone.
Ooh, nice. One from Flo or just?
Yes, one from Flo and one from Digicel. Right. Imagine that.
So we don't discriminate.
Yes, we don't discriminate at all. Right. Just like diabetes and hypertension does not discriminate against who they affect, we do not discriminate against who we're going to help tonight.
Dr. Do is quick on his feet. I see what you did there. That's beautiful. So, Dr. Do, we just want to do a quick recap of what happened, what took place a little earlier via Zoom. And if you were logged on via the television or Facebook or GVD or NTN, you would have heard some speaking in a conference format. So what it was a scientific conference. So before we talk about the details of what happened,
just come and showcase what they've done, what they've developed, what they've understood in our environment. So, for example, 15, WHO PAHO put out this statistic that we have a prevalence rate. That means we have in our population a little over 27% living with hypertension, and the diabetic range or study shows that it's just a little over 14%. Would you actually believe that was the case? Based on the hype out there, based on what it is we say, what it is we hear so much. We hear so much more about diabetes, right?
Yeah, the way we like bread and other things, it's not surprising.
Yeah, we hear so much more about diabetes as compared to hypertension. But yet, hypertension is more prevalent in our society than diabetes. Why is that? Honestly, why is that? I believe that it is because hypertension is a silent killer. What does that mean? Your blood pressure should not be higher than 139/89 at any given point. Well, unless if you're doing something exciting. But that should be very briefly, and it should come back down nicely, right? Yeah, you went off there on that something exciting, didn't you? Anyway, yeah, so anyone with the blood pressure higher than that continuously or persistently is living with hypertension. But the beauty is I can be walking around with a pressure of like 250 over 130 and feel absolutely fine. We have seen it so much in our health centers, in our hospitals. These persons will likely present for, I have pain in my foot, or I have pain in my hand. And then we check their blood pressure, we notice, my goodness, that is sky high. It's a stroke. There you go. That's a heart attack. That's kidney failure and dialysis waiting to happen. All right. But we have no symptoms until something like that actually happens. I believe that's the reason. Is that true? Do you know? I don't. Okay? And hence the idea of the scientific conference. Let us do more studies. Let us do more surveys. Let us try to understand our population better. What is driving our NCD burden today? All right? What is driving the problems that we have? What is driving all of this and slavery, you know? I mean, I want to be able to walk around free. So with a scientific conference in St. Lucia, we will be able to answer a lot of those questions. Moving forward, we also would like to give our St. Lucian researchers a stage on the international scene. We're a partner, we're a member of the International Diabetes Federation. So we would like to also take one or two of those abstracts or researches and take it to our annual IDF conference where they could represent St. Lucia and showcase what it is we've done. Because very often we say, what's happening in the first world of Koikadi, Lamaweka, Estene, we'll get the call there. So is that really true? We want to know what's happening for our people, what is really going on here. Let's use the information and let's use ours and see which one really sticks.
But Doc, you're saying you want Little Helen to do scientific research and go to big America and present statistics. I mean, you're talking about Little Helen. Little Helen.
Forgive him, my viewers. It's like he didn't just hear about Julian Alfred, right? He doesn't know about our long-standing, so high jump her name again? Laverne Spencer, yes? All right? So how could you stand here and tell me Little Helen? We're not Little Helen.
Little Helen.
We're Helen.
Right. So you think we can make a mark on the world with our statistics?
Like he did not hear about Sir Arthur Lewis, Derek Walker. Like, come on, man. Really? Let's move on. Let's move on. Because I think one of the viewers might come here down to Pero and want to tap you on it.
No, we were fine until you said Pero. They didn't know where we were.
Oh, right. Yeah, we're in Pero. Green Acres Cabana. You can come find him. Before what he's saying, he's underestimating Little Helen of the West Indies. Not Little Helen of the West Indies.
Look, before we move on, I'm a young man.
Okay.
I hope so. In my early 20s, you know. Why are you laughing like I'm not looking 20? Don't answer that. Why would I worry about diabetes and hypertension? I mean, 20 years old, I can eat what I want.
Well, that is true. At our mini symposium earlier, Dr. Jenny Isaac Lucy did highlight that we can eat everything. However, it is important, the portion sizes is important, how it's prepared. It's important that you eat it in context. All right? So why would you worry about it? Because guess what? Back in the day, our parents and so on, they used to eat a lot of what they wanted, like you're saying, but they were also a lot more active. Technology has brought us to this place where our water is right. In fact, I can put a tap right there. Right. You know, I can put an AC unit right here. I don't have to go by the river.
You don't remember the days when you used to carry the buckets,
those
by
days,
the river and wash.
Those days are gone. Those days are gone. All right. Right now we have it easier. All right. Now that we have it easier, it means we will not be as active. So you as a young man need to keep that in mind. Although the image here clearly says this young man is doing better than me. But that is life, you know, that's life.
Doc, if it's one thing we learn is looks are deceiving.
Oh, yes, all the time. You know, we have a lot of our, well, not, let me not say a lot, but we have some of our bodybuilders who do get heart attacks and do get kidney failure because they might be doing it the wrong way. They don't understand that healthy means physical activity and the right diet in a good balance to maintain a lovely cardiovascular flow. That's the big word. plumbing system.
Yeah.
The water needs to run.
Yeah.
All right. The heart is the pump. Take the blood. It needs to run through the whole body for it to do everything with vitality. Yeah.
So we're doing what's necessary to ensure our heart is working properly.
Indeed.
And the blood is flowing properly.
Indeed. So as a young man, it is important for you to keep that in mind, because we're diagnosing quite a few persons. I'll calm down on the joke now, because this is a serious thing. We're diagnosing a lot more persons at a younger age with diabetes, with hypertension. It starts with the lifestyle. All right. I mean, let's also not mention it in her presentation, the chronic disease self-management program, which speaks to the psychological aspect of it. You know, even myself, I need to understand that you need to take some time to take care of yourself. You know, we all need to make sure that we look at health as not just the absence of disease, but a state of complete social, physical, and mental well-being. So it does include me making sure that the wife doesn't nag me at night. You know, you got to take care of the wife, make sure she understands that, hey, you know, nagging will stress me out and I might not sleep well at night and my pressure will go up.
That's not a real example, right? That's just for show, for TV, right? It's for TV. It's for TV. It's for TV. Yes, sir. I mean, I'm not trouble.
You're not in trouble. Well, thank God you don't know my wife. So that's good. So, wait, no, we're on TV. Oops. Honey, I'm sorry. I'm just kidding.
He's sorry.
So, right. As a young man, it's important. You need to keep that in mind, that it can hit you early. It has been hitting us early, and you need to take a step today. Why am I sweating so much in my?
I'm cool. That's why. So basically, what he's saying: catch me on VG Beach, running up and down on the sand. I mean, in my current situation, I can only do one trip, but it's better than nothing, right?
I can do 3.
Really?
Yeah, I can do 3. VG, up, down, up again. Yeah.
Challenge accepted.
VG, yeah, man.
Challenge accepted.
20th
of September. Challenge accepted.
20th of September, yes. Look out for it.
I'll do a flyer.
And I'll finish before him.
St. Lucia moves. Let's go. So, Doc, just to talk about the rest of the programming tonight, it's not just about the two of us standing here talking.
I'm having quite a bit of fun talking to you and breaking barriers. So for the rest of the night, let's understand that there are barriers in so many different ways. And I would like to kill the first barrier here. Please don't refer to me as Dr. Daw. All right? Yeah, you can call me Daw, Kedma, you know. Yeah, let's make it informal. Let's make it easy going. And this is important, you know, because our patients, sometimes they have this block. I would speak to them, they say, "We doc." Yes, doc, I understand. By the time they walk out, they don't say, "No,
Shall we get down?
Yes. We need to really break some of those barriers. So tonight, let's start with breaking the barrier.
Right.
We're the hosts.
Okay.
All right. We're brothers. All right, in here in St. Lucia. I'm the more handsome brother.
Yeah.
Okay. So that's okay. Yeah.
No comment. So Ket.
Yes.
Just to talk about what's coming up a little later this evening. It's not just us here speaking, shooting the breeze. What else do we have? I see some guys setting up in the back. They look like folk singers. What else do we have on the program for this evening?
We have the auction. Did we even finish to talk about the auction? You see, you like to talk so much.
We spoke about the auction.
So we have the auction. We have some giveaways. And sadly, those who did not register with us on Zoom cannot take part in our giveaways. All right. Those listening to us live on NTN and GVD, we're happy to have you, but sadly, you won't be able to get any of those prizes.
Dinner,
and
brunch,
tablet, cell phones.
You know.
Oh my gosh, there's so many other giveaways.
I feel it for you.
Yeah, man. So, other than that, my favorite part.
Talk to me.
Tonight, we're gonna have a unique culinary experience.
You said culinary. Caught me at culinary.
Yes.
Yeah.
We're talking food.
Food. Yeah. We don't have to go any further.
Yes.
Should we mention who's? Okay, sorry. Go ahead. Excited now. Hungry too. Story, go ahead.
All right, so let's get back that announcer voice.
Yeah.
A unique culinary experience here at the Green Acres Cabana with the one and only Chef Orlando. So tonight, yes, he did, and he took it a step further. Mamai Lakai, you will be enjoying. All right. Yes. The best part of it all is you get to do it at home too.
That's right. So if you register, check your emails.
Yes.
The recipe is in there.
It is right there.
Right.
And all the ingredients should be right there in your kitchen. Chef Orlando is really big on this. He likes to use what we have and make a masterpiece.
Right.
He's
Chef Orlando is a Mamai Creole.
a Mamai Creole.
That's right.
That's it.
That's right.
So if you don't have a breadfruit, go and check your neighbor down the road.
They must have.
They have a tree.
It's in season.
I know, right?
Yeah.
Every single yard have a tree. Every yard.
Every yard?
And every yard. I grew up in Grosley.
Yeah.
And breadfruit.
Right.
Breadfruit everywhere.
So you don't live in Grosley anymore. Every yard has a tree.
I said every yard have. You want to challenge me? I said every yard have a tree.
I just want to make sure.
Every yard have a tree.
You mean what you say.
And I say what I mean.
And you say what you mean.
Yes.
All right.
Yes.
Chef Orlando is
Chef
on his
Orlando
way.
is on his way, and we will be putting that together. But that's not all. Education tonight. We got a little earlier. We have the Healthy Caribbean Coalition, HCC, represented by a director tonight, none other than our very own Dr. Tamara Remy. She's one of the directors of the HCC. HCC is a regional body that brings together NCDs, CSOs like the St. Lucia Diabetes and Hypertension Association, where we could share ideas, share knowledge, and work together in achieving the goal of fighting those NCDs.
Would you be talking about breadfruit as well?
Hello, everybody. My name is Juan Jose Irazabal. I'm former chair for the Mexican Diabetes Federation in the 2016-2020 period, and I'm chair-elect for the IDF-NAC region for the 2024-2026 period. And I want to thank the St. Lucia Diabetes Hypertension Association for inviting me to share these words with you. Today, I would like to talk to you about a very important issue that affects millions of people around the world, non-communicable diseases. Non-communicable diseases, also known as chronic diseases, are long-lasting and generally slow-progressing conditions. These diseases represent a significant burden for health systems, as well as for the individuals and communities that suffer from them. Non-communicable diseases cover a broad spectrum of conditions, including cardiovascular diseases, cancer, chronic respiratory diseases, hypertension, and diabetes, among others. These diseases share common characteristics such as their relationship and modifiable risk factors, such as smoking, poor diet, lack of physical activity, and excessive alcohol consumption. In addition, they may also be influenced by genetic and socioeconomic factors. It is worrying to see how the increase in non-communicable diseases has become a true epidemic worldwide. According to the World Health Organization, these diseases are responsible for approximately 71% of deaths worldwide. That is more than 41 million people each year. And the most alarming thing is that a large part of these deaths could be prevented by adopting a healthy lifestyle and making changes in our behaviors. In addition, it is essential to strengthen health care systems to ensure equitable and quality access to services for the prevention, diagnosis, and treatment of non-communicable diseases. This implies investing in the training of health professionals, improving the health infrastructure, and increasing the availability of essential medicines. It is also essential to work in collaboration with other sectors, such as the food industry, to promote the production and marketing of healthy foods. Likewise, it is important to regulate the advertising and promotion of products that may contribute to the development of non-communicable diseases. In conclusion, non-communicable diseases are a threat to the health and well-being of people around the world. However, we have the power and the responsibility to deal with this situation. We must work together to promote healthy lifestyles, prevention, and equitable access to healthy care. Only then can we reduce the burden of non-communicable diseases and improve the quality of life of millions of people. Thank you very much for your time and enjoy your evening. Thank you.
distinguished patron, Dr. Takira Glasgow, distinguished fellow speakers and presenters, esteemed guests, greetings from Healthy Caribbean Coalition, known as HCC, and directly from Sir Trevor Hassel, President and founder of HCC. It is with great honor and pride that we join the St. Lucia Diabetes and Hypertension Association tonight at their gala under the theme Breaking Barriers. Such a powerful, fitting, and all-encompassing theme, reflecting the main action needed to accomplish our shared vision of reducing and eliminating the morbidity and mortality of non-communicable diseases in the Caribbean. If you would allow me half a minute to introduce the Healthy Caribbean Coalition, HCC. We are a not-for-profit organization formally registered in 2012, although initially informally formed following the 2007 declaration on NCDs by heads of government of CARICOM. As a Caribbean NCD alliance, we work closely with our over 100 members, inclusive of health and non-health civil society organizations. We also work closely with regional and international leaders in NCD prevention and control. And at the heart of our mandate is the leveraging of influence and power of our CSOs or civil society organizations like the SLDHA by strengthening and supporting their membership in implementing programs aimed at doing exactly this, reducing the morbidity and mortality associated with non-communicable diseases in the Caribbean. SLDHA is both a member of HCC as well as a partner as we both fight against NCDs. Your theme, Breaking Barriers, as I mentioned before, is such a strong theme. It is inclusive of what most regional and international institutions have adopted as achieving the goals to influence change and to actually be successful in reducing NCDs. Your theme encompasses everything that proves to be a barrier to our rights as human beings, our rights to universal health care, our barriers that prevent access to care, funding of care, inequities of care. It extends to the barriers of the rights of children, and we focus very heavily in our rights-based childhood obesity prevention programs. Barriers to information, for example, the front of package warning labels, our campaign that has been ongoing. And this list can go on. We are proud to stand with you, SLDHA, in your fight and continued commitment to removing obstacles that we know limit access to healthcare in St. Lucia and throughout the Caribbean, in fact, throughout the world, particularly, in your case, in the areas of diabetes and high blood pressure. We remain committed to working with you, both as a partner and as one of our members, in strengthening your educational and awareness programs, increasing your visibility on all platforms that we can, and adding our voice in bridging any gaps between you as a civil society organization and your leaders and governments in St. Lucia and extended throughout the Caribbean. Let me leave you with a staggering fact. 1 in 3 of our Caribbean children is obese. This means that in a few years, 1 in 2 to 1 in 3 of our adults will be obese and will most likely suffer from 1, if not more, of non-communicable diseases. It is only with us being together and united with this theme of breaking barriers that we will be able to prevent that figure from climbing, and that we will be able to achieve the mandate that we both share of reducing and eliminating the morbidity and mortality of NCDs. Let us begin by breaking those barriers. So like you, SLDHA, we join you in your call to action to break these barriers. Thank you. distinguished patron, Dr. Takira Glasgow, distinguished fellow speakers and presenters, esteemed guests, greetings from Healthy Caribbean Coalition, known as HCC, and directly from Sir Trevor Hassel, President and founder of HCC. It is with great honor and pride that we join the St. Lucia Diabetes and Hypertension Association tonight at their gala under the theme Breaking Barriers. Such a powerful, fitting, and all-encompassing theme, reflecting the main action needed to accomplish our shared vision of reducing and eliminating the morbidity and mortality of non-communicable diseases in the Caribbean. If you would allow me half a minute to introduce the Healthy Caribbean Coalition, HCC. We are a not-for-profit organization formally registered in 2012, although initially informally formed following the 2007 declaration on NCDs by heads of government of CARICOM. As a Caribbean NCD alliance, we work closely with our over 100 members, inclusive of health and non-health civil society organizations. We also work closely with regional and international leaders in NCD prevention and control. And at the heart of our mandate is the leveraging of influence and power of our CSOs or civil society organizations like the SLDHA by strengthening and supporting their membership in implementing programs aimed at doing exactly this, reducing the morbidity and mortality associated with non-communicable diseases in the Caribbean. SLDHA is both a member of HCC as well as a partner as we both fight against NCDs. Your theme, Breaking Barriers, as I mentioned before, is such a strong theme. It is inclusive of what most regional and international institutions have adopted as achieving the goals to influence change and to actually be successful in reducing NCDs. Your theme encompasses everything that proves to be a barrier to our rights as human beings, our rights to universal health care, our barriers that prevent access to care, funding of care, inequities of care. It extends to the barriers of the rights of children, and we focus very heavily in our rights-based childhood obesity prevention programs. Barriers to information, for example, the front of package warning labels, our campaign that has been ongoing. And this list can go on. We are proud to stand with you, SLDHA, in your fight and continued commitment to removing obstacles that we know limit access to healthcare in St. Lucia and throughout the Caribbean, in fact, throughout the world, particularly in your case, in the areas of diabetes and high blood pressure. We remain committed to working with you, both as a partner and as one of our members, in strengthening your educational and awareness programs, increasing your visibility on all platforms that we can, and adding our voice in bridging any gaps between you as a civil society organization and your leaders and governments in St. Lucia and extended throughout the Caribbean. Let me leave you with a staggering fact. 1 in 3 of our Caribbean children is obese. This means that in a few years, 1 in 2 to 1 in 3 of our adults will be obese and will most likely suffer from 1, if not more, of non-communicable diseases. It is only with us being together and united with this theme of breaking barriers that we will be able to prevent that figure from climbing, and that we will be able to achieve the mandate that we both share of reducing and eliminating the morbidity and mortality of NCDs. Let us begin by breaking those barriers. So like you, SLDHA, we join you in your call to action to break these barriers. Thank you.
What do you feel should be as part of the fund, and what are the wrongs that need to be righted? And it's going to come from the St. Lucian population, from the St. Lucian people. And I just wanted to give Dame Paulette some
that assurance.
That assurance. That
Thank you for the introduction. Good evening. I am pleased to address you as the patron of the St. Lucia Diabetes and Hypertension Association. I am certain that everyone here knows someone who has been diagnosed with diabetes or hypertension. These diseases are well known and hit home. We have been taught that chronic diseases can be insidious and severe. However, we also know that they can be managed successfully with help from your healthcare team and guided self-management. We are here this evening because it is necessary to keep diabetes and hypertension within the National Health Dialogue. To get some perspective on the scope of the challenge, in 2021, the IDF estimated the prevalence of diabetes in St. Lucia at 11.8%. And in 2019, the prevalence of adult hypertension. Thank you for the introduction. Good evening. I am pleased to address you as the patron of the St. Lucia Diabetes and Hypertension Association. I am certain that everyone here knows someone who has been diagnosed with diabetes or hypertension. These diseases are well known and hit home. We have been taught that chronic diseases can be insidious and severe. However, we also know that they can be managed successfully with help from your healthcare team and guided self-management. We are here this evening because it is necessary to keep diabetes and hypertension within the National Health Dialogue. To get some perspective on the scope of the challenge, in 2021, the IDF estimated the prevalence of diabetes in St. Lucia at 11.8%. And in 2019, the prevalence of adult hypertension was estimated at 39.4%. Also in 2021, the IDF estimated that there were 537 million persons aged 20 to 79 globally with diabetes. 541 million had impaired glucose tolerance, and 390 million impaired fasting glucose, both also known as prediabetes. More than 1.29 billion adults globally aged 30 to 79 have been diagnosed with hypertension, 2/3 of whom live in low and middle income countries. Moreover, 44.7% of this number is estimated undiagnosed with diabetes and 46% undiagnosed with hypertension. These data emphasize the importance of screening and prevention. We can define our barriers in healthcare as problems to overcome or as opportunities to improve difficult circumstances. The health belief model is a useful tool that allows an opportunity to understand the patient's perspective. The model is divided into 6 main concepts. Perception of susceptibility. A person with a family history of diabetes or hypertension may feel susceptible, while a young person and those with family longevity may not. This may keep persons from accessing available healthcare at our wellness centers. Perception of severity of disease. Allotted time for communication in the clinics about what poor control is and related complications can clarify misunderstandings. Perceived benefits, that is, a person's opinion on the value of new health behavior to lower the risk of disease. Self-efficacy, confidence about the likelihood to succeed with a health-related behavior, can be achieved with multidisciplinary team support. Cues to action may be external, such as all forms of media and positive health advice, or internal, when symptoms finally manifest. Finally, perceived barriers, the cost of changing health behavior, which may be financial, concern about side effects, pain, painful injections, polypharmacy, complicated schedules, interference with social habits, inconvenience, reduced short-term quality of life. This was a powerful predictor of health behaviors. Addressing perceived barriers improves health outcomes. Due to low predictive capacity and small effect size of individual variables, the health belief model has been and must continue to be augmented and updated. In COVID-19, a sort of isolation happened, and there was disparity between perception and facts, perpetuated by disinformation technology that left some persons within their own bubbles of health information. This individual confirmation bias has existed for some time, but this has increased. We have our cultural beliefs that are respected and integrated into our management plans, but we also contend with fatalistic opinions, fixed false beliefs, variations in judgment, fear of stigma, and choices that are based on social acceptance. So what do we do to break these barriers and gain our freedom? Martin Luther King Jr. said, "The arc of the moral universe is long, but it bends towards justice." This quote is optimistic and reminds us that positive change takes time. We can see these positive changes with the expansion of universal health coverage. For persons with diabetes and hypertension, although not perfect, UHC saves lives daily once the supply chain is sound. There are useful dedicated public health diabetes hypertension clinics in some wellness centers with access to nutritionists, podiatrists, psychiatrists, and by referral to ophthalmologists, nephrologists, and cardiologists and other essential specialists. Health aides are well trained to measure and document blood pressure and blood glucose, and there are home visits as necessary, hopefully balanced with promoting autonomy and personal motivation. Management protocols are clear with the PAHO WHO guidelines, and systems are on board for monitoring effectiveness of interventions and feedback. Although we do not have immediate access to some of the most exciting up-to-date medications and procedures, bariatric surgery, tirzepatide, finerenone, teplizumab, they're sufficient for effective management and to focus on disease prevention. Beyond the clinic, effective law and order will allow safe spaces for exercise and recreation. Neighborhood characteristics and proximity determine resource access, for example, to healthy versus fast food. Community and family member support has been essential. You are the ones who show appropriate concern, comfort, and commitment. You take your friend or relative to the wellness center when you notice that they have run out of medications. You help to set up pillboxes, to bring in the barrels of devices needed for self-management. You keep them from saying, "It's just the prescription I want." You let us know at times what has not been disclosed when there has been no improvement with treatment. Family discord, depression, burnout, dementia, harassment from neighbors, abuse. Most importantly, you show that you care. To the St. Lucia Diabetes and Hypertension Association, please continue to be an oasis for our weary travelers. May you continue to open the best doors for collaboration and service above self. Let our encouragement be greater than our criticism. the arc will not bend on its own.
Great information there. Thank you so much, Dr. Glasgow, and I know that's not just everyone out there who listens. Taking a very important message here. Very important message from NCDs and how we can play our part to be better. Three very important messages there, yeah? Excellent. Three very important people.
Thank you so much, Elle. Thank you to everybody. I just want to reflect on something that Ali Gill said. He said he believes that the families that are coming forward, that are engaging with Grenada on the issue of reparatory justice in the wake of the Trevelyan family apology, Ali said, we believe this will create more pressure in British society and put the British Parliament and British government on notice for reparatory justice and reparations. And I think that that's true, and I think there is so much momentum now finally for reparatory justice. All of the great work that the Caribbean has done, the roadmap of the 10-point plan, families, government to engage into negotiations on the basis of it. I hope that this is an avenue that's opening up, and certainly I pledge my
package and you're 80 today, Glacia, you qualify.
So, Golden 80 Plus Healthcare Package. Pour Guamun, 420 et puis plus.
Oui, Glacia. The package also includes provision of prescription drugs at the Community Wellness Center Pharmacy and also 1 annual hearing test at Entrepot Wellness Center or Viewfort Wellness Center.
Moi, ça joint prescription oui med moi. Et yon fois par l'année, moi ça fait screening pour zo way moi.
Oui, Glacia. Access to eye tests and surgery.
Moi ça ouais docteur Zier. Et si moi ni pour faire l'opération et puis c'est Cuban en clinique là à Victoria Hospital.
Safe while bathing, making bathing easy. Drive Medical's products are made durably and to last. Drive Medical's shower chair with back is designed to aid you in the bath or shower. Let's learn more. By offering extra support and stability, you can remain independent and safe while bathing, making bathing easy. Drive Medical's products are made durably and to last. This shower chair can fit your unique needs, featuring a removable backrest, height-adjustable legs, and supportive handles. Featuring non-slip technology, the drainage holes allow water to pass through the chair to avoid cooling, while the textured seat helps prevent sliding on the chair. Additionally, the non-slip rubber tips help prevent the chair from sliding on the wet floor. This product is made for a dual fit, so you can use your shower chair in both the shower and the bath. Drive Medical's shower chair with back can help provide you stability, security, and safety while bathing. Regain your independence and purchase today.
At Dutch Lady, we give you delicious and nutritious milk. We make sure our milk is filled with essential nutrients, calcium, vitamins, and protein. Dutch Lady gives everyone in the family a strong start to the day. Keep your family healthy and happy. Dutch Lady, building strong families since 1871.
Incorporating safe, gentle exercise into your daily routine can offer substantial benefits to your life and health. For people who prefer or need a low-impact activity, Drive Medical's Exercise Peddler is an affordable, convenient option. Sitting on a chair, couch, or bed, users simply pedal at a safe, comfortable speed with arms or legs. This resistance knob allows users to adjust the tension to fit their level of ability. It's great for stimulating circulation and toning arm and leg muscles while watching TV or even reading a book. Users can just sit and pedal from the comfort of their home, office, or anywhere, so there's no worrying about the weather or having to put on workout clothes. And these rubber anti-slip pads help protect floors and prevent sliding. This exercise peddler assembles without tools. You may want to consider a Health Ox pulse oximeter to check your pulse rate while exercising. You can always count on Drive Medical to bring you convenient and innovative lifestyle solutions, now and for the road ahead.
All right, so you've been hearing my Creole, the sound of my Creole, and if Ken would just shake the jacket a little to see how much water has been collecting under there. You never see it like
We've also partnered with ICA and other agencies to improve the crop. We've brought in, over the years, different cultivars to enhance what we have locally. We've also gone out and done a number of trainings in cultivation, the agronomy of the crop. Along with that, we have not just only done the agronomy, we've also done value-added trainings with agro-processors. I remember one of the major actions that we had recently was with the bakers, where we introduced, through a project funded under the FAO, cassava mash into bread making. So cassava has historically been with us, and most of us who are old enough will remember the days of the cauldron or the caron. Those came from the old sugar plantation. And also the stresses associated with, you know, the cultivation of, not necessarily the cultivation, but the preparation of the harvested crop and the in automated grating machines. Some people may remember St. Lucia Rural Enterprise Project, where through that project, VJ cassava producers changed from manual to automated. We also had some automated storing facilities. It is prudent on our part at this time to go back and review these investments and see where they're at, and the ones that have not survived, and find out what the reasons they have not survived. But
that's number 6, French pass, number 7, exercise peddler companies, Peter and Company. The brand is Drive.
Just like the shower chair. But on a serious one, guys, trying to win the peddler for me, you know? I don't know, hectic lifestyle, so I could actually exercise in the night just.
The next time, then you just stretch, and then you look like,
this guy remembers everything, huh? You just stretch.
You just stretch.
I'll be there. I'll be there.
Roots of somewhat. Well, there's also some giveaways happening in
yes. Yes, we have one winner so far. You see the Swedish massage. Touch there. So, if you have not been paying attention to our Zoom platform, that's the point of register.
Yeah.
We have some giveaways for you.
How more giveaways?
A lot more giveaways. I think I have at least 15, 20 more giveaways. So, let's just keep it going. Pay attention to that chat. I'm going to be throwing some really simple questions. First one to give you the answer. Simple as that.
Simple as that.
Yeah.
Next question we're going to throw in there. We want to guess Ked's age. Guess his age. If you win, we have some nice prizes there. We'll get him another nice prize, yeah? Alright. So go ahead, guys.
That's confidential.
Don't worry about that. Go ahead, guys. Just go let the baby face.
Guess
his age. Go ahead.
You have more entertainment? You have more
entertainment?
Yes.
Yes. Lots of entertainment to come.
All right.
All right. I'm a mindful of y'all. Very well. Keep doing it for us. And the chef is almost ready. I hope you have the ingredients and everything on the side. Put it together. Because guess what? There are even more giveaways. So when we put together this meal, we expect you to take a picture of your creation. Share that with us. Alright? We will be giving away some compliments. Some really lovely hampers that we're going to give it to them. Alright? Select the hamper. Get the hamper. We have a special prize to the winner. The best looking, the one who uses all the ingredients, showcases all the things.
Right?
Right?
We're getting ready to bring my Michael back to give you some more entertainment, but I know where I'm going when I'm done here to get some other Dr. Isaac, when you
I didn't realize like that, but I'm like,
well, I know that shit. I can say no, always your favorite preparation. Favorite preparation. Once my dad gave me a bread cup shake. I'm gonna tell you. Wow. Your mother didn't know? Yeah, my mother didn't know. No, it's a secret. It's a secret. Okay, I can't. One in a minute. I don't know. You are one in a minute.
Sandra said that Chef Orlando will make me love them. So, Mom, if you're watching, let's see if you can do just that. She came close to it once. She came close to making me love that.
Well, Chef Orlando, I'm going to task on his hand. But Michael, ready for let's make it dancing.
Thank you.
Drive Medical's shower chair with back is designed to aid you in the bath or shower. Let's learn more. By offering extra support and stability, you can remain independent and safe while bathing, making bathing easy. Drive Medical's products are made durably and to last. This shower chair can fit your unique needs, featuring a removable backrest, height adjustable legs, and supportive handles. Featuring non-slip technology, the drainage holes allow water to pass through the chair to avoid pooling, while the textured seat helps prevent sliding on the chair. Additionally, the non-slip rubber tips help prevent the chair from sliding on the wet floor. This product is made for a dual fit, so you can use your shower chair in both the shower and the bath. Drive Medical's shower chair with back can help provide you stability, security, and safety while bathing. Regain your independence and purchase today.
At Dutch Lady, we give you delicious and nutritious milk. We make sure our milk is filled with essential nutrients, calcium, vitamins, and protein. Dutch Lady gives everyone in the family a strong start to the day. Keep your family healthy and happy. Dutch Lady, building strong families since 1871.
Incorporating safe, gentle exercise into your daily routine can offer substantial benefits to your life and health. For people who prefer or need a low-impact activity, Drive Medical's Exercise Peddler is an affordable, convenient option. Sitting on a chair, couch, or bed, users simply pedal at a safe, comfortable speed with arms or legs. This resistance knob allows users to adjust the tension to fit their level of ability. It's great for stimulating circulation and toning arm and leg muscles while watching TV or even reading a book. Users can just sit and pedal from the comfort of their home, office, or anywhere, so there's no worrying about the weather or having to put on workout clothes. And these rubber anti-slip pads help protect floors and prevent sliding. This Exercise Peddler assembles without tools. You may want to consider a HealthOx pulse oximeter to check your pulse rate while exercising. You can always count on Drive Medical to bring you convenient and innovative lifestyle solutions, now and for the road ahead.
I don't need to expose myself. Yeah, man. What we're doing now? Thank you, Michael. Yeah. What we're doing now is called the Lucia movement. Once you move it, that's it. That's it. I played my part. I contributed to the eradication, reduction of NCDs. I moved. That's right. Dr. Isaac is very proud. Oh, yes. In the chat right now, back to the room, they gave us a nice lunch of some pre-cut pastas and Chef Orlando, correct? Yes. So, and our winner for tonight was Yasmin Porters, via direct message. Nobody listens. I like this guy. I will not be offended, you know. You can say I'm 19. I know I didn't finish. Michael Time should be, you know, for making Ken look so young tonight. Yeah? They have no filters on, man. They do. But the thing is, when I look at myself, I check the cameras, I don't filters on. But when I look at the camera, I look at myself. You know, I'm looking at it a while. So, I just fix that in my case. Yeah. I don't even go to throw this image off. Yeah. Not that, after all, I am the host. Somebody got to good.
The host with the most.
There you go.
So we have a sponsor here with us.
Oh, yes, we have a sponsor. And a very important sponsor, you know. Tonight, I would have to say tonight, really would not be possible if her team did not come on board to provide us this beautiful location. Green Acres, Gala.
Stress a little more on the beautiful.
My gosh. There is a view. There is a view, if I can tell you. That view. I could wake up to that every morning. I could wake up to that every single morning. And right now, it is nice. Don't mind the sweat. The breeze is actually coming through. But my Michael, they have me moving. Okay? They have me moving. It's been a while since I danced like that.
Yeah. All right.
But I'm doing my moves when I'm getting there. Yeah. Always the belly might be flat by the end of the night. It's flatter in there.
Right, so let's bring on, let's have a conversation with our I'm going to hand them back to the host with the most, and he's going to drill, no? Have a conversation.
All right, tonight we have. Thank you so much again, Mrs. Marie. Dantes, yes? I got that right. I pronounced it correctly.
Sure did.
I didn't say Saint. It's okay. Right, so Marie, thank you so much again for having us. And tonight, I think everybody wants to know a little more. Okay, so let us know a little more about Green Acres Cabana.
Awesome. Thank you so much. Thank you for using the Green Acres Cabana as the destination of choice to host such a lovely event. And also, it's an honor and privilege for us to be part of it. Welcome everyone. Good evening to all our viewers. My name is Marie Dantes. I am part owner of the Green Acres Cabana, which is located in Piero Viewport.
Where is that? I don't think everyone knows that because we have a lot of people that come. Like, South.
Now you know?
Yeah, we had to give him Google Maps. Right. But he found it so quickly though. It's not that hard to find.
That's the technology.
Yes, it's not that hard to find.
That's right. The Green Acres Cabana, it is the hidden gem in Piero.
Indeed.
It is a view to die for. Service exceptional. The food, oh my goodness. The cocktails, listen, need I say more? This is the place to be. And tonight, we are hosting our friends here with the special, the first annual Emancipation Gala. Wow! At the Green Acres Cabana. Breaking barriers.
Yes.
So
what sort of services can we get here? To our listeners who are interested in coming out.
At the Green Acres Cabana, we offer services to all sorts of events. Whether it is a small private birthday party, whether it is a wedding for 300 people,
we haven't had bash.
End of the year corporate events,
the bash,
anniversary, or just because date. Just when you tell to that special someone, I love you just because. The Green Acres Cabana set up candlelights. We also have Airbnb, where you could book from one night onwards.
You can all spend the night.
That's right. You will have breakfast the first time. is an honor. It is an honor.
Everything first have Green Acres.
At the Green Acres Cabana.
Come have your first date. Come have your first, well, there should not be any other proposal, right? Come have your proposal dinner. Come have your wedding. Come have your hideaway. You know, there's a swimming pool now.
There's a swimming pool as well. Yes.
There's a lovely view where you could talk.
And the view is immaculate.
Yes, indeed.
And the breeze, fresh, lush green, fresh air. There is no fumes to breathe here.
Indeed.
The moment that you drive into the cabana, it is just history.
Yes, looking over the lovely Savans Bay.
Savans Bay, that's correct.
You see that bay right there, you see the time.
The Scorpion Island.
Oh,
we have the
Scorpion.
view of St. Vincent as well on a good day. As well. Yes.
Beautiful.
Thank you so much.
Thank you again so much for hosting us. The St. Lucia Diabetes and Hypertension Association. It would not be possible without you and the rest of our sponsors. We are so grateful, so happy that you decided to come on board with us. And it is an honor to be in your presence. Your hospitality is unmatched. Right?
We wouldn't have it any other way.
Yes. Thank you again.
You're very welcome. Thank you so much for having us, and thank you for hosting this special event at the Green Acres Cabana.
The pleasure is ours.
Much love.
Indeed.
Okay, all right then. Pleasure. Thank you. Okay.
So what's your favorite breakfast dish?
I just told you.
What's that?
Breakfast chicken. Not an actual dish. I'm a simple diet. Breakfast and salad.
Saltfish has too much sodium in it. It has too much salt. Okay, so we have to be careful with saltfish. For the focus of our Breaking Barriers NCD, please note, let's be careful with saltfish. Everyone out there, I know it's our Pakistan dish. Yeah, so just be careful with it, okay?
Chef Orlando is on his way. We're going to talk to him about a healthier way to prepare
the breakfast.
Saltfish.
Breadfruit. No salt.
There's no saltfish?
There are many fishes in the sea that way. But no, saltfish. Alright? Alright, we have some more performances.
Yes, we do?
Yeah. We have some lovely acts that was supposed to be here. And they're going to share with us something. They have a nice dance. Alright, and we have a lovely song by Alana Nuno. Did I say that right? Alana Nuno. She is from Alana plays tonight.
So we bring
Alana? Yes?
Bring Alana
down?
Yeah, we have Alana ready. Alana is a singer. $1 trillion.
See, you keep underestimating Sandwich. A while ago you said little Helen T said, man, Helen. $1 trillion.
So, we ready for that? Let's go.
Standing on the edge of losing everything. You're out of options, out of hope. You've lost your way. Your happy ever after didn't turn out like you planned. Searching for a solid place to stand. Looking at the ashes of what could have been. You can't help wondering if you finally reach the end. Yet in this place of weakness is where miracles begin. Watch and see the dead can live again. This is where amazing happens. This is where God Yes, there's been a night, and healing cannot come without a ruined life, and mercy's only given to the ones who've made mistakes. Only shattered life sees amazing grace. This is where amazing happens. This is where God steps in. This is the place where broken dreams can live again. When you're to the end of hope, nowhere left for you to go. Welcome to the place of second chances. This is where amazing happens. Oh, nothing's ever found unless it first was lost. There's not a resurrection without there is a cross. This is where God steps in. This is the place where broken dreams can live again. When you're to the end of hope, nowhere left for you to go. Welcome to the place of second chances. This is where amazing happens. Oh, when you're to the end of hope, nowhere left for you to go. Welcome to the place of second chances. This is where amazing happens. This is where God steps in. Oh, this is where amazing happens.
Learn to walk with $1 trillion voice. I would love to hear that again. Hopefully we have some time later to play that video again. I just want to hear it for a second. Big up to you. So some more entertainment. We're going to bring back on the group. There's another dance. We bring on another dance.
Yes. Well, we bring on a dance.
We bring on a dance.
Yes.
7 minutes. Okay. So we have one more video before.
The dance legends.
Dance legends.
Dance legends.
Right. I was a dance legend. I don't know what I was talking about. Better. Do you have dance legends? Queued up?
Yes.
Southern peace, barren, strange fruit, blood on the leaves, and blood at the roots. Black bodies swinging in the southern breeze. Strange fruit hanging from the poplar trees. Pastoral scene of the gallant South. Them big bulging eyes and the twisted mouth. Scent magnolia, clean and
We didn't.
My Creole. So we're ready to bring back my Creole? Ready to tap those feet again? Alright, when you fall asleep tonight, tomorrow midday you get nothing. But my Creole love you, so. Alright, let's throw it back over to my Creole. Hello, remember to get up.
Dance, don't sit around. You need to listen with your feet. But my Creole.
Thank you.
Mene na Timo so beti
Apa pe betis.
Sa beti encore c'est titi betis 12.
Ah, ben on peut faire chai pour ça pour betis là. Mais ce n'est pas point couper il me fait capon chai temps pour faire.
Blague manga ba yo.
Moi ça même cadeau pour faire chose.
Oh,
And I inspired like you because it's really, one restaurant there, me pinching for 10 years, but I mean, you've done what I want to do.
Oh, really? That's what your dream to have the Airbnb?
I mean, it's a restaurant right now, 10 years, 11 years.
Oh, wow.
So we're going very well, and people know us globally. But, you know, the vision is to do an Airbnb.
Airbnb, and it's coming.
And restaurant, yeah.
Yeah, it's coming.
So, you know, so we get the coconut. Okay, so if I explain to you, let me get my thing, so. There is soup. Soup food is already seen.
Okay, well that's good.
So we have everything's prepared already, so it's just kind of like just getting things together.
This one has like your bread.
Yeah, absolutely. You can put it up on that, yeah.
Okay.
Yeah. So we already got
everything is already fresh.
Yeah,
so that's
yeah,
good.
that's already ready. So I have that's the main course.
The cameraman.
The main course, that's the soup.
Where's your mic? On this? Your mic is on this?
Big mic for you. That's fine.
So you could just speak?
Sorry, yeah, just when you speak,
you just have to speak a little loud.
Thanks, Doc. I will definitely crush. I mean, I think you look tired as well.
And I'm working at midnight.
At the hospital?
Yeah.
Really?
Yeah, so I'm actually happy you took me off.
No, well, you know, it just takes 2 hours to clap, huh?
Yes.
You know, and I mean, obviously, I know we're going a little late, but you know, I hope we can soon make it happen to you.
Yes, that'll be nice.
I love the idea. I mean, we've got to, but everything's ready, so we can do it in half an hour. We want to make sure everybody have a good time. Yeah?
Cabana. C-A-B-A-M-A. My name is Marie. I just saw some cards this morning. Let me see.
Yeah, let me see the business card to you. In my card, yes. That's my name.
Let me see what we see.
Please face it familiar.
Chef. It's been a while, no?
Been a while, eh?
Been a while, yeah.
Been a while.
You good?
Yeah, I'm there, my boy.
Yeah, great.
I'm there. I said, this is familiar.
Yeah.
You live on here?
No.
You live in Castries?
Castries, yeah. Yeah.
But Doc grew up you as well?
What's that?
Doc grew up you as well?
Yeah. Rub everyone.
Oh, you know?
Yeah.
Why not?
Yeah. So we had to make sure he eats some breadfruit tonight, huh?
Oh. Funny thing, I had a nice breadfruit cake. I love a breadfruit pudding, but you guys didn't.
Yeah.
I left it in soup. I left it in about the meat.
Yeah, we could talk about it. So as soon as you, let me not tell him. As soon as you
or do we stop presenting?
Welcome to Jessica in Pereira.
your location. So we show what you're doing. So we have down. Yeah, then you just don't.
Yeah, you just don't. Yeah.
That's not very secure.
Towards the rectal.
And when I put it together,
Drive Medical Shower Chair with Back is designed to aid you in the bath or shower. Let's learn more. By offering extra support and stability, you can remain independent and safe while bathing, making bathing easy. Drive Medical's products are made durably and to last. This shower chair can fit your unique needs, featuring a removable backrest, height adjustable legs, and supportive handles. Featuring non-slip technology, the drainage holes allow water to pass through the chair to avoid pooling, while the textured seat helps prevent sliding on the chair. Additionally, the non-slip rubber tips help prevent the chair from sliding on the wet floor. This product is made for a dual fit, so you can use your shower chair in both the shower and the bath. Drive Medical Shower Chair with Back can help provide you stability, security, and safety while bathing. Regain your independence and purchase today.
At Dutch Lady, we give you delicious and nutritious milk. We make sure our milk is filled with essential nutrients, calcium, vitamins, and protein. Dutch Lady gives everyone in the family a strong start to the day. Keep your family healthy and happy. Dutch Lady, building strong families since 1871.
Incorporating safe, gentle exercise into your daily routine can offer substantial benefits to your life and health. For people who prefer or need a low-impact activity, Drive Medical's Exercise Peddler is an affordable, convenient option. Sitting on a chair, couch, or bed, users simply pedal at a safe, comfortable speed with arms or legs. This resistance knob allows users to adjust the tension to fit their level of ability. It's great for stimulating circulation and toning arm and leg muscles while watching TV or even reading a book. Users can just sit and pedal from the comfort of their home, office, or anywhere, so there's no worrying about the weather or having to put on workout clothes. And these rubber anti-slip pads help protect floors and prevent sliding. This exercise peddler assembles without tools. You may want to consider a Health Ox pulse oximeter to check your pulse rate while exercising. You can always count on Drive Medical to bring you convenient and innovative lifestyle solutions, now and for the road ahead.
Drive Medical Shower Chair with Back is designed to aid you in the bath or shower. Let's learn more. By offering extra support and stability, you can remain independent and safe while bathing, making bathing easy. Drive Medical's products are made durably and to last. This shower chair can fit your unique needs, featuring a removable backrest, height adjustable legs, and supportive handles. Featuring non-slip technology, the drainage holes allow water to pass through the chair to avoid pooling, while the textured seat helps prevent sliding on the chair. Additionally, the non-slip rubber tips help prevent the chair from sliding on the wet floor. This product is made for a dual fit, so you can use your shower chair in both the shower and the bath. Drive Medical Shower Chair with Back can help provide you stability, security, and safety while bathing. Regain your independence and purchase today.
At Dutch Lady, we give you delicious and nutritious milk. We make sure our milk is filled with essential nutrients, calcium, vitamins, and protein. Dutch Lady gives everyone in the family a strong start to the day. Keep your family healthy and happy. Dutch Lady, building strong families since 1871.
Incorporating safe, gentle exercise into your daily routine can offer substantial benefits to your life and health. For people who prefer or need a low-impact activity, Drive Medical's Exercise Peddler is an affordable, convenient option. Sitting on a chair, couch, or bed, users simply pedal at a safe, comfortable speed with arms or legs. This resistance knob allows users to adjust the tension to fit their level of ability. It's great for stimulating circulation and toning arm and leg muscles while watching TV or even reading a book. Users can just sit and pedal from the comfort of their home, office, or anywhere, so there's no worrying about the weather or having to put on workout clothes. And these rubber anti-slip pads help protect floors and prevent sliding. This exercise peddler assembles without tools. You may want to consider a Health Ox pulse oximeter to check your pulse rate while exercising. You can always count on Drive Medical to bring you convenient and innovative lifestyle solutions, now and for the road ahead.
Drive Medical Shower Chair with Back is designed to aid you in the bath or shower. Let's learn more. By offering extra support and stability, you can remain independent and safe while bathing, making bathing easy. Drive Medical's products are made durably and to last. This shower chair can fit your unique needs, featuring a removable backrest, height adjustable legs, and supportive handles. Featuring non-slip technology, the drainage holes allow water to pass through the chair to avoid pooling, while the textured seat helps prevent sliding on the chair. Additionally, the non-slip rubber tips help prevent the chair from sliding on the wet floor. This product is made for a dual fit, so you can use your shower chair in both the shower and the bath. Drive Medical Shower Chair with Back can help provide you stability, security, and safety while bathing. Regain your independence and purchase today.
You can pass it.
It's not up.
Right here. The last white door.
Yeah. Thank you.
Food experience.
Ooh, I'm ready. Are you ready?
I'm ready.
He's ready. I think he started sweating more when we came in the kitchen.
Yeah.
But you know, started seeing all that breadfruit.
But you know, all that breadfruit all around St. Lucia.
Yeah.
You know, in these times we can do so much with our breadfruit, and clearly what we're talking about right now in the moment of diabetic and health ideas. How can we not share the love with breadfruit?
Right.
Yes.
So tonight we're gonna have some fun with the breadfruit. You know.
I'm ready.
Yeah, ready?
Let's go.
Let's go with Chef Orlando himself. Tell us a little about yourself before we get kicking.
Well, Chef Orlando, I've been in St. Lucia now over 20 years. I have Orlando's restaurant in Soufriere. It's all about the cuisine. It's about promoting local. My vision is the best cuisine in the Caribbean should be Caribbean cuisine. So at the moment, you know, when you come to Orlando's, there is no menu. You come, you tell the price, and we cook for you. And it's a 5-course tasting menu, everything 100% local as possible. And the whole idea is to give you that experience.
Yeah.
This is St. Lucia. We need to be proud of what we do. And it's very important, something like this now, really a big plus to me, because I really believe for an island like ours, to have such a high rate of diabetes is so important for us to eat more healthy. Critically about eating healthy is about timing and what we eat and the time we eat. So I'm really hoping that this simple menu will give you some inspiration on what you can do with breadfruit, but ultimately do it with a healthy breadfruit.
Right.
And it's not about the big portion, it's about the consistent small portion.
There you go.
Okay.
So when you go to a restaurant and you see they give you these small portions, don't complain.
Don't complain.
It's for a reason.
It's for a reason. It's to make sure that you are able to continue the night, not because you're kind of full. Right. You're comfortable. Okay.
Right. And you don't fall asleep in the restaurant.
Say no more. Say no more.
All right, so we're ready.
We have kids in the house. Let's focus on the food. We have kids in the cuisine.
All right, so we're ready to cook.
Okay.
If you're on Zoom, you have that menu in your email.
Yes.
Hopefully you have everything
Everyone
ready.
who registered via Zoom, received that menu, received the mise en place,
yeah.
right? So they have how they should have prepared it, and chef already has everything prepared.
Yeah.
All right, and we have another winner, Crescenda. I'm sorry, I'm just going to take advantage of the moment. Credential Wilfred. She won a glucose monitor with strips, compliments, trade win.
Nice.
Good looking out. Yes.
Nice. Yeah, keep checking. All right, so.
Okay, so of course, we appreciate we've got a little short time. So you've got the menu, you've got the recipes. We're going to do the simple process and presentation today, so you understand it, and you can always follow up with me again. Food doc, you can always contact me if you're not too sure what's going on. Make sure we keep it simple. I'm going to show you the very simple part of our breadfruit soup. Breadfruit, again, is a very starchy product. So you can do so many things with it. You can obviously make it into soup, make it into salads, make it into even dessert, breadfruit pudding. There's a dessert, Today we've taken breadfruit along with some local onions, some scallions, and fresh turmeric. And actually, we've actually cooked it down, and we actually use vegetable stock. Another thing that people tend to do is stop buying those, another one, not going to be, but those Maggi salty products. We can make our own vegetable stock. Yes. Usually when you peel your vegetables, like you have peeled carrots, and you may have some leftover things, put in cold water with some bay leaf, a little cinnamon, and then bring to boil, and then chill it and put it in your fridge. And that's your natural vegetable stock. Okay? So now you got more, when you buy those products which have a lot of sodium enzymes, this is where a lot of problems come as well,
Right.
Okay, so we've got our soup ready, and I've already pre-prepared it already. We're going to present it to you so you can get an idea how it's going to look. Come right over here. We also, just a little note for you, nothing wrong having bread, but you can have a little bit of, instead of a garlic bread, you can have a little, what I call island seasoned bread. So we can take our local Creole bread and then slice it very thin, and then put a little blend season on top of it, and then we're going to just put in it's a little touch of oil, not much, and then you're going to get really nice and crispy, and we're going to serve that with our soup as well. You know what I'm saying? The idea though is not to overdo the project. Food is about eating, cuisine is about sharing the experience. So when you're sharing the experience, you don't go too big on the experience. You just go, nice to meet you, come back soon.
Right,
you know what I'm saying?
Right.
Okay,
yes,
good.
Yes.
So, and get a pan nice and hot. You know what I'm saying? That's important. But again, folks, let me explain to you as well. I really believe that we in the islands, in the Caribbean generally, have an opportunity to eat more healthy. And we don't have to wait until we get to this process of diabetes or any other kind of illness to start eating healthy. If we start investing in ourselves today, tomorrow we don't pay for the hospital bill. Right. You know what I'm saying? And that's the old process. Preach. Okay. So let me put it in the pan. You're going to get it nice and crispy there, so, you know what I'm saying? There's a little bit of oil. Also, what's also nice, you can also use just a little soya oil, or if you choose, a little coconut oil, but not much. Just to give it a crispy flavor of coconut, but then again, you want the bread nice and crispy. So, gonna get it really hot there. Get that going. We'll go to our soup now while that's going. Now again.
So how do we just put the chopped breadfruit in there? And we
Doc, that sounds like a doctor saying that. You just put the choppings in. You gotta saute, okay.
Oh, okay, saute.
So what we tend to do, we have a nice hot pan. A lot of people tend to make soup by putting stuff in a pan and pour the stock on it and then boil it and then blend it. You're making a soup, so you have to allow the pan to bring the flavor up. You know what I mean? So make sure you don't burn our bread. Oh, beautiful.
I like my bread nice.
Crispy there.
Just beginning to be crispy.
So what you then to do, you get a nice hot pan, you put your onions, you put your turmeric, and of course you put your breadfruit in your pan, and then allow without no stock, and then just allow the pan to release the ingredients. Once you release the ingredients, then you can add your stock. The idea is not about just boiling vegetables, you're actually making a soup. So you want to allow the pan to kind of bring the flavors together. You know what I'm saying?
Don't boil, saute.
Sauteed, eh? Okay. And that's the whole idea. Again, yeah, I know these guys are like, Doc, you do what you do, okay? I see. But but again, folks, we understand the process because people are against time. So we understand the time process of preparing food and everything else. But mise en place is critically important. The word mise en place is to prepare in advance. So today we've done some prepare in advance. And I mean, again, when your soup, how do you know it's right? You don't have to know it's right. It's what's right for you.
Right.
It can't be I'm not in your home tasting your food. Right. So long as you're happy with the flavor, you can put a little heat if you want to. You can put a little, make sure you're happy with it. What I'm doing is giving you guidance to an idea. Yes. You don't have to, it's not about taking my idea, it's about a guidance and you work with it.
Yours,
and make it your own, okay? Yeah. But of course, think healthy and you think process. Okay, so once your soup has been, your vegetables have been sauteed down, and then you kind of know it's kind of soft, you take your stick blender, which is usually an stick blender, and blend it or put it into a robo coupe. I'd recommend, if you're going to use a robo coupe, make sure it's a little cool because you don't want to explode over you and you get burnt. Okay. So that's critically important. Okay. So rather you cool it down a little bit before you actually go with and blend it, Right. Okay.
All right.
So we're going to now...
So we've blended, we've cooled down.
Yeah, we've blended, we've cooled down. Right. Okay. And now what we're going to do now, we'll warm back up again slightly, and we're going to transfer it into a pan. Now again, so 1 cup. Now it's 1 cup. I mean, I know there's a young man there, so I've given a healthy portion, but generally it's just, when you come to Orlando, there's 5 courses. So, it's all about, petit manger.
Yeah, right.
Small plate of the Caribbean.
Right.
So we've got a coconut oil, coconut milk, just a little touch, a drizzle. You don't want to drown it. And it's still looking nice drizzle across. You see?
Yes.
Okay, you got a beautiful touch there.
All right.
And now we're going to put our bread on top.
Yeah, I'm tempted.
Yeah. Allow your temptations to run.
Yeah, there you go.
It looks just like that picture.
Yeah, and then...
everybody on Zoom knows about the picture.
Okay.
Because they actually have a picture of what it should look like. Right. So don't forget, while you do your preps at home, take a picture of your final product.
Send us pictures.
So send a picture, and I will pick in your best ones. We can consider a winner.
Yeah.
So there you have your soup ready to go. Okay, so we can eat that now?
Who, me? I can dive in.
You can dive in. Right,
so no, hold on. I'm gonna be a gentleman and allow Mr. Ken to just
it's okay.
just and if tonight you go and you say, Mommy, I need you,
to make a small spoon. It's a taste, huh?
It's a taste.
I told them I don't like breadfruit.
That's okay. We understand that you want people to force to eat breadfruit. long time for kids. But
yes,
I get it. I understand it. But this is not your regular breadfruit.
This is not your regular breadfruit.
This is not your mama's breadfruit, huh?
No, my mama's. Hey, don't talk, mommy. I love your breadfruit. I love you, mommy, but I don't love breadfruit.
It's not your mama's. This is not your mama's breadfruit, okay? It's a different.
No regular.
This is no regular, okay?
So here's my advice to you. Since you like your bread, how about you take a slice of that bread with the soup in there, you know, and then let's see what it says. I want you to zoom in very close to his face as he tastes it.
And just remember, it's not your mom's breadfruit, huh? And we know your mom's are the best.
Yes,
that's why she's mom.
Yes,
but this is Orlando's.
Yeah. Okay. All right. So quiet on set. Here we go.
These people.
Here we go. And he's about to taste. And he's laid it on his palate, rolling it around his mouth. Yeah, checking it out. He's checking it out. He doesn't look too dissatisfied. Okay, hold on. Let's get his comments on the breadfruit. So hold on. Comments on the breadfruit soup with some crunchy local bread in there.
It's nice and creamy. Okay, nice and very creamy. No flavor is overpowering. You know, I sound like a real food critic.
Yeah.
Yes.
Keep going.
But the interesting thing, I don't taste breadfruit.
You don't taste the breadfruit.
I don't
Welcome to the breadfruit family. Welcome back.
So the only place Ken will be eating breadfruit is in Soufriere at Orlando's. Yeah.
I'm not telling you that this again. But yeah, it is good.
Yeah. So this coming from
a man who's been forced to eat breadfruit.
Man who is really unhappy with breadfruit.
An unhappy breadfruit man.
Can we move on to the
really unhappy with breadfruit. He says the breadfruit soup is mwah. Yeah. All right, so we have another dish.
Yes, we can move.
He didn't taste the breadfruit. The point is, there's breadfruit in there. I'm so happy to have been witness to this site.
Amazing opportunity.
It's amazing, amazing opportunity.
I shall taste the spoon.
Oh, so you're leaving with the spoon?
That's my spoon.
Okay, all right. So we have some more dishes to taste. So do not put that spoon very far.
No, that's my spoon.
Yeah, those pockets look like they may.
Okay, folks, so we're now going to make it our next simple dish. And again, this is where making our main course come together. And keeping it simple, we're going to do a breadfruit cake and served with mai. Now, one of the ideas that I tend to realize that we tend to murder the fish. People, stop murdering the fish. What do I mean by murder? First of all, you kill the fish in the ocean. So when you get it home, don't murder it on the stove. People we understand the process that people go, we know as a West Indian, we make sure we don't see no blood in the fish. Yesterday I had a fellow in my restaurant and I gave him a seared tuna and it turned out to cook perfectly. I'm called a West Indian. He goes, can you have more cooked? I think about my blowtorch your fish for him. But it's okay. You did what you had to do. But the problem is that I understand that we as West Indians and sometimes persons are not familiar with the way fish is supposed to be done. Fish is supposed to cook very gently and delicately. Another part of our problem is that we tend to overcook it. So the fish itself, what we eat in the fish is the flavor more so than the fish being cooked properly. So when you're cooking fish, it's especially mai, tuna, kingfish, blue marlin. Especially blue marlin and tuna, you just kiss the girl. Honey, I'm home. You know what I mean? This thing about this taking the fish and leaving the stove there for the longest time. Sometimes what you can do, you can actually touch your fish in the stove. By the time you've turned around, it's to continue cooking. You see? So I'm going to show you a simple trick on our mai today. So we keep it simple. Right. So right before we start, we're going to go back to our bowl here. We're going to we're going to saute some vegetables and everything else, so we can add to our breadfruit. So we're going to get a pan hot. Okay. We'll get our pan hot for a little while, and we'll touch a little oil in the pan. Give it a few minutes. I'll introduce my ingredients to you. So So we have some white onions, we have some peppers, some parsley, red pepper, some little red onion, and also some chives.
How do you get to chop that so small?
No, that's a good question you asked there. So I figure we can take 1 second to just very quickly show the audience about chopping techniques. I brought some knives with me. And I'll use the star fruits just to show you a look at chopping technique. Now, some star fruit is one of those beautiful fruits as well, which is underused. But again, important to make sure you have a good sharp knife. You know what I'm saying? That's a critically important part as well. You know what I'm saying? And a lot of people buy cheap knives, but you realize cheap knives, they don't last long. So the best is spend the money and invest in your knives, man. When you're chopping, make sure you can do that. Okay. Make sure you can do that. What does that mean? That means there's no blood. Because if you're doing that, that means you're rubbing your knife against your skin there. So the point I'm making too, people tend to get cut right there because when they cut in, their hands are exposed. So my point being, you gotta do your finger there, so you can do that.
Okay, so you bend the fingers.
So you bend your fingers. So when you're doing that, you allow the knife to rub against the skin. So if you're doing that, you're good to go. You rub against your skin, and you can feel it rub against your skin. So much so you can do it blindfolded. You see? You can do it blindfolded because you can do it blindfolded. You can look at you and say, okay, I'm still chopping, but don't do it to own people because you can blame Chef Orlando, you cut your finger off, but that's not the point. You know what I'm saying?
Okay, I'm scared.
Okay, so again, that's a simple technique there.
Okay, nice. And that's... I'm off duty.
Oh yeah, but I got a doctor in the house. There we go. Oh my goodness. I was feeling more secure now. Okay. Another thing, you may have seen it, but I'm going to present you my seasoning. I call it Mom's seasoning. Why is it called Mom's seasoning? Because everyone does Mom's seasoning. Everybody has their own version of Mom's seasoning. So I'm calling it my Mom's seasoning, which is basically onions, celery, garlic, local seasoning.
Okay.
But all of us do our own version of it. So I'm calling it Mom's seasoning because every mom has a different version.
Yes.
Okay. So let's go over here. Again, slightly get it hot. We can put. It's important to get a little, and then we're going to put a few onions there. Sauteing. See, my boy got it right. We don't have to saute.
So you hit the pan first.
You hit the pan, yes.
So it could bring out that
flavor. There you go.
Yeah, I'm a chef now.
Good choice. Now, remember, you can add all this stuff you want to, but as long as you keep moving it around. Now, one thing I'm going to take to you, a lot of people tend to use spoons in their pans. I would like to show you, because Doc's going to get me to, I'm going to get Doc here to do some work just now. Keeping it simple.
I got you.
Okay, keep it there.
I'm representing all the amateurs out there.
Okay, good.
Yes.
You're going to put them parsley there. Now, you notice I'm not using no salt. I'm not a big salt fan, but you can. You choose to add salt, but I'm saying I'm not a salt fan.
1/8 of a teaspoon per dish.
Per dish, yeah?
Yes.
But I'm not a big salt fan, so I will show you something in a while. Okay, so you got your red onions there. Now, instead of doing your pan stirring, what I want you to do, Doc.
No.
Okay, Doc. So can you get the mic? I want Doc to always pan. Come on, Doc.
Yes.
Okay. So what I want Doc now is to do the pan down, back.
You really want me to make a mess?
Go, okay, I'm going to hold your mic for you, Chef. Go ahead.
Okay, so
just take your hand.
No, down and back. Come on. Back. Okay, come on. Come in. There you go. Okay, Chef. Okay.
All right.
I'm feeling the love there. They did a good job enough. Okay, good enough. You can grab your mic.
Thank you.
Okay, fine. So let's bring our seasoning peppers and everything else back to our table.
And the aroma, you could take it. The kitchen is
it's coming alive, huh?
It's alive. It is alive.
Someone's kitchen. So of course it is our breadfruit. Our breadfruit has been pre-prepared.
Yes.
Again, what we're doing with the breadfruit, we've just peeled it and we've just cooked it and we've mashed it up here. Okay, so what we're going to do, we're going to put the breadfruit into our bowl. See? again, it's a good portion there, but we make it to accordingly. And then we're going to add our wonderful seasoning to it now. We're going to add our wonderful seasoning to the breadfruit. Now, again, if folks are vegetarian, this would be a wonderful vegetarian idea for someone who's vegetarian. You're saying, what you could do the same thing with this, where you can take nice carrots and different kind of vegetables, okra, and make a little curry flavor and add it to that, and then you can just do a little cassava. Instead of using breadcrumbs now, you use cassava, and then you got a wonderful idea for vegetarian. You're saying, or you do it with a Creole sauce,
Very nice.
I'm saying, again, the idea is to eat healthy. Now, so what we have here is a little ring. Now, for all you folks at home, we can't afford to buy these. I don't recommend it, but tin tuna. Throw the tuna away. I'm joking. Open the two ends and use the tin. Wash it out, and you can use recommend it. So you can
large one, a small one.
A small tuna tin. So you can cut both ends. Wash them very clean, and then actually use that for your ring, So what we're going to do?
So you can get that right portion size.
Get right portion size,
yeah.
So we're going to now put our breadfruit mash into the ring. So you keep it nice and simple.
If you guys could enjoy this aroma of this kitchen now.
So we're keeping it very simple. Now again, these are simple ideas you can do. Imagine you can do this with green banana. It just works with green banana. It works with dasheen. I mean, all these local things that we can do. We don't have to keep buying this, foreign stuff, but we don't have to do it. We can use local, and we can be more creative with our local stuff. So the breadfruit. I was amazed to see how much breadfruit around the place. I went to the market.
You're saying there's a tree in every yard.
Oh, absolutely. So there's no need to do without. Okay, so what we're going to do, put our pan back on the stove. Get the pan back deep. Put our pan up there. I can place this in the sink there.
Yeah.
Get it out of the way. So what we're going to do now, I'm sure everybody's looking and goes, we're doing a lot of frying. We're not doing a lot of frying, really. I'm just showing you simple ways of doing it. You don't have to fry this, actually. You can actually grill it. You can actually grill it if you want to, and then stick it in the oven to make sure you get it hot. I'm just using the pan as just a simple way, but you can actually take the same idea, put a little oil in your pan and grill it, and you get the same effect, rather than all this frying oil and everything else. It's just the persons who are concerned again. Of course, we are concerned about diabetics, so we don't want too much oil cooking. Okay? But I'm going to use it all there today. Right. I think I'm going to cook this. Yes. He's working hard there. It's okay. Keeping it simple. So now we're gonna get the pan hot. Let's go over here. We're gonna make a very simple plantain salsa.
Right, so everybody would have had the instructions for that plantain.
Yes, so we got
peeled it, sliced it, cooked it a little, and then diced it.
Yeah. Oh, okay, chef. Okay.
Yeah.
All right.
Yeah. So that's exactly what it should look like.
Yes, it should look like. Yes. It should look like. We also have our seasoning. We have a red pepper.
Mom's seasoning.
Mom's seasoning. Mom's seasoning for me is the basis of all our food. That's where we add the love, in my opinion. So it's keeping that simple, and you don't have to overstretch the situation. Can you grab the fish out, please? The fish. In there, yeah. We don't want to murder our fish, yeah.
Freezer.
Right there, it's in there. Okay, so again, it's keeping this stuff really simple. There you go. Our mai mai. Our mai mai is, for me, again, people, take that smell. Bear in mind, when you marinate your fish, you're already pre-cooking it slightly. You leave that fish long enough, it will cook, you can eat it raw. I know it's Lucia, oh my God, you do raw fish. No, if you do it right, it can stay. So this fish now, up my it's actually been pre-seasoned already. We've actually used a little bit of mom seasoning as usual. Usually a little cayenne, a little spices, and a little molasses. I'm a big fan of molasses, but I understand the process, so we just use a little bit in moderation. You know what I'm saying? And that's what we're going to try and do. Okay. Our pan is getting hot. Beautiful.
Always preheat the pan, huh?
Preheat the pan, absolutely important.
So it could bring out that flavor.
Yes.
We're gonna let's do our cake. So let's reveal our cake there now. Take out the ring, and there's you got a beautiful, beautiful cake. So I'm gonna transfer it to a pan. Now again, all we want to do with that is just get it to come alive. You get a little nice little crust. We could pop it in the oven if you want to make sure it's hot inside, but I'm going to show you how to do it simply. Again, folks, think about it. You are eating healthy. You're eating healthy, and the whole idea is about the experience. You know, imagine presenting this to your family and friends at home, and you can get someone to say, wow, I'm having an experience. And that's the whole idea, okay? So I know some people are thinking, well, this looks rather interesting, and it's all like a long night party, but no. We've got a spatula there. Or we do, yeah, the black one right there. The black one, yeah. Or we do what the chef does at home, flip it. Just in case you missed it, we'll do it one more time.
Scary. Ooh.
Okay, but we'll flip it. And get a nice, you see, and what you want to do, if I come to the camera there, then you get a beautiful golden color. Is what you want to capture there. And you got to, I mean, that is a nice, beautiful opportunity for someone to have some love, as we say. Okay. Folks, you always need to say, share the love. Share the love. Just to let you look acronym, it means St. Lucia, STL. Share the love. Think about it.
Share the love.
St. Lucia.
STL, you know?
Okay, fine. Just got a message? Okay, good. There you go. So that's our cake there. It's beautiful. Absolutely beautiful. Now I'm going to get our pan is there. A touch. Now, this whole idea of the fish. Again, folks, don't overplay it. It's just simple fish. Don't murder the fish. What you can do, this take 2 or 3 minutes. We're going to put it right in the pan. I'm going to do 2 pieces there because I know that we have family and friends.
I love fish.
Okay, so now you can see the fish is there. You want that for a couple of minutes. Not even so long. Now what I'm going to do with it, I'm going to turn it over. Look at that fish there. It's nice and clear. Now I understand for people who have diabetes and all sorts of things, you don't want to cook it too much oil. So I'm going to show you a little trick. You're going to add a touch of water if you want to, or with the stock will be made still. It's a touch of stock. And it just comes, vegetable stock, it comes alive. If I leave that fish here for a few seconds, it'll continue cooking. So I can turn the fire off now. And by the time I come back to that fish, you'll see that fish is going to be nicely cooked. And even that, you can always go back to it. The thing, like, folks, once you've murdered, you can't go back to it. But once it's undercooked, you can always cook it again a little bit more. That's the point I'm making. So people tend to go, oh my God, if it's overcooked, you can't go back. But once it's undercooked, you can always go back and reheat, you know? That's the point I'm making. So we're going to leave it for a few seconds, and you'll see, and I mean, our friend here will make sure that we get a wonderful experience of the fish. Let it sit for a few seconds. Let us go over here and make our salsa. Oh, we got your spoon. Okay. let me grab my bowl there.
I'm sure that spoon still doesn't work.
Again, it's something easy. You're planting your red onion. Okay, you got your peppers. Now again, if you come to my restaurant, I'm always playing with this. This is for me one of my number one salsas. I mean, it's easy. Now salsas, you're supposed to have a little vinegar. You're supposed to have a vinegar, a little sweet, and then a little spice to bring it off, a little oil. That's the concept of a salsa. So what we're going to do right today, I'm going to give you a little bit more mom seasoning.
I think the fish is lonely.
So a little mom seasoning there goes in there. Okay, I'm going to take a little sugar syrup. That's a little touch of sugar syrup. This is my dessert, but it's in prepare it, and it's my strength going to myself now. Come on, young man. I need a young fella to open that. So my strength gone already. I mean, I'm tired. Yeah.
Ooh.
You got it?
Yeah,
oh boy. Oh, there you go.
Yeah.
Okay. This is a little sugar syrup. It's a combination of cinnamon, bay leaf, just a little sweetener.
So for those who need to measure, you want to go a half teaspoon?
Half teaspoon, perfect.
Yes, all right.
Okay. So there's a little sweetener there. And now in that sugar syrup there we have bay leaf, we have some cinnamon, we have ginger, we have the love. You know what I'm saying?
The instructions are all in your document.
All in the document there. Yeah. Now we would also add a little vinegar to that. You know what I'm saying? And we also add again a little touch of oil. As I said, that's a touch of oil just to sort of break up your Okay. Now a nice idea. As I said before, you can see the beautiful colors in that there. It's keeping it simple. You're saying? You got your plantain, you got onions, and of course, yes, a little vinegar would be nice, a little sweetener. Again, I have not put no salt, but I'm going to show you the salt trick in a minute. Okay? Now, I think our fish, have you got your spoon, chef? Because you'll be trying to cook the fish to make sure that, I mean, now it's cooked already, go for it. Taste that one right there. There. Look at the fish just break to you. Look at the fish.
That was perfect. Yeah? You know, it was very easy to break through.
Fish just cut through like.
You don't have to ask me twice.
Soft, beautiful.
Nice.
And again, as you can see, folks. Now, normally you add some carrots there, you know. But I mean, I'm just showing you the guys for presentation, as you know we're doing.
Yeah.
It's an idea. Now, this would be a decent portion, but I mean, again. For somebody who is not a big eater, you can have one piece of that fish. You take your salsa now, and then you can put on top. If I move the pan out of the way, so you can just see what's going on. Yeah, so again, folks, you know, this is you at home. You know, we understand that, you know, when you come home from work tired, you know, you ain't got time for this mise en place. But if you do preparation yourself and before you go to work, you'll be surprised how enjoying your food can be. I mean, you know what I'm saying? And again, it's all local. Now, a little trick there. Keep it simple there. I do have some salt warming here.
Fish is awesome.
This is actually an Himalayan black salt. You can have them. You don't have to have all this salt, but you can get this kind of expensive salt, which just gives you a little. You want a little flavor? Just put a touch on your plate, just to sort of around your plate. So if you want to add a touch of salt, you can get a flavor there. Okay. And then, of course, what we have, one more thing here, is some molasses. Again, just to sort of pick up the plate. It's all about keeping it simpler. So this is my staff put in this way tighter. And they're saying, it's show business. This is not show business. This is your business. Okay, put it all into there. Okay. And then we're going to do a little drizzle around the plate. Just to give you a little bit of flavor. And of course, you know, I'm sure some of you have seen all this wonderful thing in the supermarket called microgreens. Just to sort of elevate your plate presentation. Just to sort of give your plate a little, say, like, honey, I'm home. You know what I'm saying? It's all about presentation sometimes, you know. And you can then take your beautiful, and then you got your wonderful mai on your breadfruit cake with a nice plantain salsa. And that's your main course.
Lovely.
Yeah. And so now, I don't know who's going to try that, but I'm going to hope you're going to take some pictures before you send it out there.
Yeah, you can try it out.
But again, folks, the simplicity of the fish cooking. You don't have to over-murder the fish. If anything you take away from today's conversation is stop murdering your fish. You know what I'm saying? That's the whole reason. It's already murdered, so don't kill it again, huh? As they say, I mean. Yes. Okay, wonderful. So now we're going to go to the dessert. But let's get a bit of break down here. But I want this young man to taste it. You're going to taste this first before we...
Could you please guide me to a spoon?
Okay.
All right.
Dum, dum, dum.
Okay, now when you tackle and a portion like this, you want to tackle it with love.
I know, he's going there so much of
I appreciate you're hungry, but you don't attack something like this, love. You take time. Nice to meet you, honey. Let me just take you from the side and, introduce you. Okay, go for it. You go for it. I know it's late night TV, but still. but if you look at if you show your cameras there, you can look, the fish is perfectly cooked.
Perfectly cooked.
We're not talking about overcooked fish here.
I just touched it and fell off.
We're not talking murdered fish.
Correct.
Okay, good.
I just touched it and it fell off.
So go for it. Now remember, this is what we call just cooked with love. Taste the breadfruit combined with the fish here.
That's right.
And the plantain salsa, you remember, I didn't put no salt in the plantains, but you got a little salt around just to sort of pick up the flavor.
Go. You ready for this?
He told you not to attack it. He just shoved it in.
That's good.
Does it taste like breadfruit?
That's good. Doesn't, It has a texture, but it doesn't taste like breadfruit. Yes, sir. Totally different taste. It does not taste like breadfruit. And that's a problem.
No, that's good for me.
No, this is good. This is really good. Dr. Isaac, I hope yours tastes like this.
Well, folks, I mean, at the end of the day, we're here to share the opportunity for a diabetic conversation. Yeah. And the more we can do about this, to introduce to our the Caribbean, we in St. Lucia can find ways to eat more healthy. Yes. I mean, and of course we have things like breadfruit is a very easy process. I mean, and how we can do stuff. I mean, dessert. I'm going to keep it simple for you. Very simple dessert, but I'm sure any one of you guys can do this 3-course menu again using breadfruit. I'm saying, and I'm encouraging restaurateurs, especially restaurateurs, is to be more creative with our local ingredients. I mean, that's the whole process of the conversation. I'm saying, okay, so we're going to go. You wait for the dessert now. We've got a pan on there already. Okay. So what we've got here is our wonderful ingredients. Some mango. We've got some mango. We have mango. We have papaya. We have our wonderful syrup, and of course, we've got some star fruit. But before we do that, I want us to sort of have a bit of fun with the see, doctor, I need you to open the coconut, please. Oops. A man like you. Yes, I need your creative skill. Okay. So,
challenge accepted.
Yeah.
So I use the back of the knife.
There you go.
There you go.
Okay.
There you go.
So we just.
Hold on. But you got to do it. Okay. I want a clean cut. Go for it.
Clean cut.
Okay. But very good, very nice. But you see the idea, you got to turn it so you get a consistent clean cut.
Okay, fair enough. Let's go.
This is for our international audience. We were thinking, how do we open coconuts? And as Doc has shown it, it is so simple.
Voila!
There you go. Thank you so much.
You're welcome.
But again, clean up.
Clean enough. Yeah.
The only thing, Doc, love you. But I want 50-50 coconut. You give me 70-30. It's okay.
Just like insulin.
Just like insulin. Very good. So now we're going to use our coconut to present our wonderful dessert. Keeping it simple. So since doctors give me 70-30, well, that's beautiful presentation cup. So we're going to be creative idea. I like that idea. Okay. See, so we're going to go there. So again, let's move over to our pan. We got a nice hot pan on the stove. At this point now, we're going to put a little bit of our syrup in the pan.
What's in the syrup?
Okay, in our syrup we have cinnamon, we have bay leaf, we have again a little vanilla, some fresh ginger, and we've got a wonderful syrup there. And what we're going to do now is actually add our fruits. Now we add the most firm fruits first, like star fruits. So we're going to add that. We're going to add the star fruits. And then we're going to add, we've got some papaya. You see a little soft there, we're going to add that in there. Knock it out. Just give my fingers, folks, but this is national TV, so we can have fun. And we're going to add our mango. Okay. Okay. So we're going to move that around the pan there. Now, of course, if you were diabetic, you wouldn't want to add rum. But if you were not, you would add a little rum to this, can make it with rum. But we understand the process, so just we'll leave it alone. I got a doctor in the house saying to me, "Hell, run from the rum."
When the cameras go off,
we'll add a little rum to make it a little bit more fun. You know what I'm saying? The rum to add more fun, as they say. I mean, let me get a bit of mix up there. Now, if you don't have a glass bowl like these, which are a nice idea, if you at SNS and you buy those candles, which can actually, once you clean them up, don't throw them away. They become useful to serve your desserts in and put stuff in them.
Okay.
Just an idea. So I mean, I don't talk too loud because next time SNS start charging double the price.
Yeah.
But anyway,
we'll censor that.
We'll censor that, yeah. Okay, good. Okay. But we don't waste anything. I mean, we're talking about taking care of ourselves, our health, and everything else. Okay, get that going. Now, for our mixture of granola, we've actually got some wonderful our coconut, which we did earlier in the fall.
Yes.
We have coconut. We have breadfruit crumbs. So now you got to see breadfruit in a different way now. You got breadfruit there. Yeah. We have our granola mixture there, a dry coconut mixture, and we've also got some oats. Yeah. And again, no sugar, folks. No need for sugar.
Yeah.
Okay. Now, again, what you do, you would mix these together. If you grab me a bowl, please.
But Chef, a lot of these things actually come with their own sugar.
That's the point I'm making. Yeah, that's the point I'm making. You got that on there, coconut. Okay, we've got a nice bowl down below. And you give it a little rinse. So, we have our coconut. Now again, I know you can have a crumble, you would add a little butter. But since this is granola, we're not going to add butter. Okay? So again, persons who want a crumble, it's fine. But again, this is going to be more granola, so we're going to add our coconut homemade granola. We're going to take our breadfruit, taking our oats, and of course, some pre-prepared granola here, just to get a bit of mixture. And all we're going to do is give it a bit of stir. Okay? Very simple. And now, if I'm going to give it a nice little turn. I see you're looking to running far. Okay, don't run far, Chef. give it a turn for me. Let me grab one more pan there. Give it a turn.
Get in there. Get it.
Go for it.
Get it, boy. Get it. Get it.
Got it? Don't throw it. Don't waste it, huh? Okay, good. Wonderful.
Yeah.
All right. So I'm going to put a pan on the stove back there.
Yeah.
So now, what could happen when you're making this dessert? You can either put your coconut, your fruits into your coconut or your glass jar, and then put your granola on top and pop it in the oven. It takes about 5-10 minutes just to warm it. Yeah. Or you can reverse it by getting a nice hot pan, and we're going to transfer our granola in the pan again just to warm it up. You know what I'm saying? So since we're using the coconut, we'll go and present it this way. So while the pan's getting hot, we're going to take we've got our coconut here, and we're going to put all our mixture right into your coconut.
Yeah, it brings out the flavor.
Bring the flavor. You got it,
That smells good.
That's it. You're saying, and remember, it's a beautiful dessert. I mean, I've given you an extra portion there. Some people in the house hungry, tired, want to go home. Yeah. But wake up, come to Orlando's. You know, get the look of love. Take that there, and then now we're going to take our granola mixture, just a little bit on top in the pan there, just to sort of bring it alive a little bit. Remember, we're not adding no sugar, nothing. All we're doing is just warming that on top there. Again, normally we put it in the oven and then finish off in the oven. But again, you can actually warm your granola mixture. Just so remember, the granola is going to give you that wonderful crunch. It's going to give a wonderful crunch on your fruits, and again, it's very natural and it's very local, and that's the whole concept of today. Okay? And of course, warming it up gives a wonderful turn of feel there. Again, folks, we are here to give you an idea of how to be creative with your local ingredients. We don't have to reinvent the wheel, just reposition it. And of course, the concept is the valuation of wealth is health. You can have all the money in the world, but if you have no health, you're just enjoying the money.
Yes, sir.
You know what I'm saying? So the vision that we're trying to share with you today, and I really appreciate Doc inviting me on and give you guys an opportunity to talk about healthy eating, and especially us men. I'm going to cut away from the conversation diabetic. Take also note for our prostate. Be mindful, guys.
Yes.
Take health very seriously. It's not about living life. When you look in the mirror, see your health first and foremost. Okay. Right, we're good to go. That's our granola mixture. Let's transfer on top of our wonderful fruits. Yeah. So you got a wonderful crunchy. You're going to get a beautiful flavor there. And then now we're going to take our coconut. Put on top there, and then we're good to go. Actually, I think we're kind of settled. I'm happy with my presentation. That's clean plate. And I want to thank the owner of this beautiful restaurant. Actually, she kind of stay in the background before we go. She has to come out.
I think she should come taste the dessert.
Yeah, come and taste the dessert.
Yes, yes.
Come and taste the dessert. Yeah. And then we have our wonderful dessert.
That really does.
I mean, again, so what we have is a very simple dessert. We have a caramelized fruits, again local fruits, a little sugar syrup. Again, you can put less sugar, but just a little touch of sugar syrup using your fruits. And of course, you've got your granola mixture. You're using breadfruit, you're using oatmeal, and then make a little granola mixture. And then combine. And you share with love. So let me, now I've got a lady in the house. Come on, man.
Share my spoon.
Okay. And this is the owner of this wonderful kitchen that I've escaped to all the way from Soufrière. I've come all the way down the coast to discover this wonderful place.
To the Green Acres Cabana.
Green Acres Cabana. What a beautiful location. Yeah. The best kept secret next to the Orlando's.
Yeah.
I get it. I understand it. so much so now, I got to feed you now because now, you know what I'm saying? Now I got to feed you. So again, when your guests reveal their experience,
Wow.
And of course, it's very much a simple, little warm. Just be careful. Okay, honey, this is just first. Okay. Yeah.
The
coconut, the breadfruit. Yeah. The breadfruit. No, that's a good thing, you see, but it's in there. The breadfruit is in there. The breadfruit is in there.
Delicious.
Wow. Okay.
So,
I would definitely serve this in my restaurant, chef.
There you have it.
There you have it.
Amazing.
I think you have
3-course meal.
Wow.
Using our local breadfruit with love.
Breadfruit with love.
With love. So when you see breadfruit walking by the street, pick it up. Start thinking what you can do with it.
Respect the breadfruit.
Respect the breadfruit. I like that. Respect the breadfruit.
Coming from you?
Coming from a gang, we don't like breadfruit. But again, I want to thank the audience for your patience tonight, and we understand the time. But again, we thank you for your patience, and we do look forward to you enjoying a cuisine of St. Lucia.
Right.
And I mean, doesn't matter where you eat it, whether here in Vieux-Fort, in Soufrière, but even in St. Lucia, we as St. Lucia should be proud of our cuisine.
That's good.
It's called our cuisine. So take note of it. Enough with those other stuff, And of course, the valuation of wealth is health.
But that's it.
Thank you so much, Chef Orlando.
Thank you, Chef.
Marie.
Thank you, Chef.
Thank you so much. Nice to meet you.
And to our lovely audience, we want to say thank you so much for staying so late with us. We went way over the time, but we appreciate your patience. And there you have it, a 3-course meal in the right portion sizes, just so it would appreciate. Yes?
Yes, absolutely.
Right portion sizes, 3-course meal, breadfruit theme, breaking barriers. That first barrier is thinking that eating healthy is boring. No, it's not. Clearly it's not. It's clearly not.
Breadfruit is not boring.
Yeah, I actually have to. Yes,
respect the breadfruit.
Respect the breadfruit. Respect the breadfruit.
I think we should say respect the breadfruit.
Yes.
Okay.
So thank you so much again, everyone, for staying tuned in. We look forward to. I know everybody might not have created their own
version of it,
masterpiece, so we're going to give you 1 week to create your masterpiece, upload those pictures, so we could judge it, and you can win the rest of the prizes that we have.
Wow.
Okay?
What an offer.
So again, thank you, Chef Orlando.
Thank you so much. And we hope to see you.
And Green Acres Cabana. And all the rest of our sponsors, Peter and Company, Tradevin, Digicel, Flow, Marcy Stores. I can't forget anybody.
Oh, you, Doc. Thank you.
We have Cocoa Palm Resorts. We have Sandals Halcyon. All right. We have Great Vision Design. Come on, give it up for them. We had a few glitches with the audio, but we stuck through and we're here. All right. Thank you so much, guys. All right. NTN for streaming us live as well. All right. Ministry of Health. Mr. Sant Justin, all right, Minister of Health, Wellness, Elderly Affairs, all right. We thank the St. Lucia Diabetes and Hypertension Association. My team, the board, we could not have done it without you. And everyone who's participating, thank you so much, and have a lovely evening as we continue to break barriers.
Bon appetit.
And bon appetit, indeed. Respect
share the love, the breadfruit.
Respect the breadfruit.
Respect the breadfruit. Okay, very good.
Special thank you to you, dog.
Yeah.
Thank you.
Thank you so much, guys.
Yes, thank you, guys. Thank you. DVD, thank you. Chef Orlando.
Thank you, Owen.
Love. Thank you, guys. Thank you. All right.
Very good.
Okay.
At Dutch Lady, we give you delicious and nutritious milk. We make sure our milk is filled with essential nutrients, calcium, vitamins, and protein. Dutch Lady gives everyone in the family a strong start to the day. Keep your family healthy and happy. Dutch Lady, building strong families since 1871.
Drive Medical Shower Chair with Back is designed to aid you in the bath or shower. Let's learn more. By offering extra support and stability, you can remain independent and safe while bathing, making bathing easy. Drive Medical's products are made durably and to last. This shower chair can fit your unique needs, featuring a removable backrest, height adjustable legs, and supportive handles. Featuring non-slip technology, the drainage holes allow water to pass through the chair to avoid pooling, while the textured seat helps prevent sliding on the chair. Additionally, the non-slip rubber tips help prevent the chair from sliding on the wet floor. This product is made for a dual fit, so you can use your shower chair in both the shower and the bath. Drive Medical Shower Chair with Back can help provide you stability, security, and safety while bathing. Regain your independence and purchase today.
Moi point des zombies, moi point toi zombie, ma cap point zombie encore. Moi point zombie, moi point des zombies, moi point toi zombie, ma cap point zombie encore. Moi point yo non maye, moi point des non maye, moi point toi non maye, ma cap point non maye encore. Moi point yo non maye, moi point des non maye, moi point toi non maye, ma cap point non maye encore. Moi point yo jamet, moi point des jamet. Moi point toi jamais, ma cap point jamais encore. Moi point yo jamais, moi point des jamais. Moi point toi jamais, ma cap point jamais encore. Moi point yo rasta, moi point des rasta. Moi point toi rasta, ma cap point rasta encore. Moi point yo rasta, moi point des rasta. Moi point toi rasta, ma cap point rasta encore. Moi point yo politician, moi point des politician. Moi point toi politician, ma cap point Ignatius encore. Moi point yo politician, not at all. Moi point toi politician, ma cap point Ignatius encore. Moi point yo voler, moi point des voler. Moi point toi voler, ma cap point voler encore. Moi point yo voler, moi point des voler. Moi point toi voler, ma cap point voler encore. Où les tétés, où les tétés, où les tétés, où les tétés, où les tétés. Tété nous calé, tété nous calé, tété tété nous calé, tété tété nous calé, tété tété nous calé, tété nous calé. Où les tété pas qu'à dormir dehors, où les tété pas qu'à dormir dehors. Maman il a nous libéré, maman il a nous libéré. Tété nous calé, tété nous calé, tété tété. Bye bye, bye bye maman. Nous calé, nous caille vivre. L'année prochaine, la caille ni jazz, la caille ni jazz. Nous caille vivre, ici caille ni jazz, ici caille ni jazz. Nous caille vivre, où les tétés pas qu'à dormir dehors. Au plaisir madame nous calé, au plaisir madame nous calé. Tété, 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 papa, tété, 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 papa, papa.
Let me tell you something. I really